Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, distinguished guests, healthcare professionals, and my fellow students from around the world. A warm virtual welcome to each and every one of you as we gather here today for the highly anticipated first international online seminar held by Universitas YPIB Majalengka on readiness of healthcare professionals in facing opportunities and challenges in the Society 5.0 era. It is an honor to serve as your host and master of ceremonies. My name is Prijas Dwiana, and I will guide you through this transformative exploration of healthcare in the digital age. In this unprecedented era of Society 5.0, where technological advancement and societal needs converge, the healthcare industry finds itself at the forefront of a profound transformation. Today, we will delve into the critical role of healthcare professionals in embracing the opportunities and tackling the challenges presented by this new paradigm. Throughout this virtual seminar, we will be privileged to hear from distinguished speakers, renowned experts, and thought leaders who will share their insights, experiences, and research findings. As healthcare professionals and students, we play a pivotal role in ensuring the well-being of individuals and communities. This seminar aims to equip you with the knowledge, tools, and strategies needed to navigate the complexities of the Society 5.0 era. It is an opportunity to broaden your horizon, enhance your skill, and embrace the transformative potential of technology in healthcare delivery. I would like to express my deepest appreciation to our esteemed speaker for graciously sharing their expertise and valuable insights with us. Their contribution will undoubtedly inspire us and spark meaningful discussions that will shape the future of healthcare. I also extend my gratitude to the organizing committee and technical support team who have worked tirelessly behind the scenes to bring this virtual seminar to life. Their dedication and commitment have ensured that we can gather here today, transcending geographical boundaries and connecting healthcare professionals from all corners of the globe. As we progress through this online seminar, I encourage you to actively engage in the interactive sessions, participate in the Q&A segments, and utilize the networking opportunities available to you. Share your perspectives, ask probing questions, and forge a connection with the fellow professionals and students who share your passion for advancing healthcare in the Society 5.0 era. Remember, the collective wisdom and collaborative efforts of healthcare professionals from diverse backgrounds will pave the way for innovative solutions and improve patient outcomes. Let us seize this opportunity to foster a global network of like-minded individuals dedicated to shaping the future of healthcare. On behalf of the organizing committee, I extend my heartfelt appreciation to all of you for joining us in this virtual seminar. May the knowledge shared, discussions held, and connections made during this event propel us forward in our mission to deliver compassionate, effective, and technologically empowered healthcare to all. So without further ado, let us embark on this enlightening journey together. May this international online seminar be a catalyst for transformative change in the healthcare landscape. Welcome, and let the exploration begin. We are going to start with playing a national song, Indonesia Raya, and Mars YPIB. To all participants, please sit up straight and pay attention.
Universitas YPIB berjuang untuk menggapai asa. Satukan tekad, dorakan semangat, ilmu, amal, iman, dan takwa. Universitas YPIB profesional dan mandiri, cetak intelektual berakhlak mulia, menjadi pilihan bersama. Marilah kita satukan langkah menuju masa depan yang cerah. Ayolah kita derapkan langkah menerjang halangan tantangan. Universitas YPIB, tangga meraih cita-cita. Masyarakat sehat sejahtera, SDM tingkat negeri sentosa. Universitas YPIB berjuang untuk menggapai asa. Satukan tekad, dorakan semangat, ilmu, amal, iman, dan takwa. Universitas YPIB profesional dan mandiri, cetak intelektual berakhlak mulia, menjadi pilihan bersama. Marilah kita satukan langkah menuju masa depan yang cerah. Ayolah kita derapkan langkah menerjang halangan tantangan. Universitas YPIB, tangga meraih cita-cita. Masyarakat sehat sejahtera, SDM tingkat negeri sentosa. Masyarakat sehat sejahtera, SDM tingkat negeri sentosa.
Coming up next, we have the Executive Chairman report by Mrs. Lina Siti Nuryawati, SKM SST MTes. So Mrs. Lina, please take the stage.
Readiness of Healthcare Professionals.
Assalamualaikum warahmatullahi wabarakatuh. Good morning and best wishes to all of us. The Honorable Rector and Chancellor of YPIB Majalengka University, the Honorable Dean, as well as Vice Dean of the Faculties of YPIB Majalengka University, the Honorable Head of Study Programs of YPIB Majalengka University, the Honorable Presenter of International Webinar. Let us express our gratitude to Allah Subhanahu wa Ta'ala for the blessing and guidance given to us, so that today we are still given how to be able to take part in this webinar. Salawat and greetings may always be poured out for our great Prophet Muhammad Sallallahu Alaihi Wasallam and his family, companion, and followers until the end of time. We can welcome all of you who are present in this Zoom room. Our webinar revolves around the theme, Readiness of Healthcare Professionals in Facing Opportunities and Challenges in the Society 5.0 Era. This theme is highly beneficial for us healthcare professionals. In this webinar, we will delve into this theme from the perspective of midwifery, nursing, and pharmacy sciences. To gain further insight, let us listen attentively to the presentation delivered by our four excellent speakers. We are pleased to report to have a total of 2,119 participants and 29 speakers who will be presenting their oral and poster presentation during this webinar. Our sincere appreciation goes out to the sponsor and all participants who have supported this webinar event. Lastly, as the chair of the webinar committee, I wish you all a wonderful day. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Following, there is a welcome speech from the foundation advisor of Yayasan Pendidikan Imam Bonjol, Haji Satmaja BA. To Haji Satmaja, please take the stage.
Assalamualaikum warahmatullahi wabarakatuh. Yang terhormat seluruh pemateri seminar internasional dari berbagai negara. Ada dari Arab, Saudi, Malaysia, dan Filipina. Yang terhormat Ketua YPIB beserta para pendiri YPIB. Yang terhormat Rektor Universitas YPIB Majalengka. Yang terhormat Bapak dan Ibu dosen dan seluruh staf Universitas YPIB Majalengka. Yang terhormat peserta acara webinar. Assalamualaikum warahmatullahi wabarakatuh. Puji dan syukur kita panjatkan pada Allah Subhanahu wa Ta'ala yang telah melimpahkan nikmat dan karunia-Nya kepada kita. Selawat dan salam mudah-mudahan selalu terlimpahkan dan tercurahkan kepada Nabi Muhammad SAW berserta keluarga dan sahabatnya, dan tidak lupa pada kita semua sebagai umatnya yang selalu taat akan ajarannya. Alhamdulillah berkat rahmat Tuhan yang Maha Esa Allah Subhanahu wa Ta'ala, perguruan tinggi Universitas YPIB Majalengka yang selebihnya telah berjalan kurang lebih 30 tahun, yang tadinya Sekolah Tinggi Farmasi YPIB Cirebon dan Sekolah Tinggi Ilmu Kesehatan Majalengka digabungkan menjadi universitas. Alhamdulillah. Maka pada saat ini bisa menyelenggarakan seminar internasional yang pertama di tahun pertama untuk berdirinya Universitas YPIB Majalengka. Salam sejahtera dan salam inovasi. Saya dengan rendah hati menyambut para pemateri dan peserta webinar. Semua di dalam acara seminar internasional ini yang diselenggarakan oleh Universitas YPIB dan keluarga besar YPIB Majalengka. Acara ini memiliki tema yang menarik dan relevan, yaitu Readiness of Healthcare Professionals in Baik of Cleaner and Religion in the Society 7 5 or 0 era. Seiring dengan kemajuan teknologi yang pesat, kita telah memasuki era society 5-7 to 0, di mana teknologi dan manusia bergandeng tangan untuk mencapai kemajuan yang lebih besar. Di dalam konteks perawatan, kesehatan, perkembangan ini memberikan peluang yang tidak terhingga, tetapi juga tantangan yang kompleks. Oleh karena itu, penting bagi para profesional kesehatan untuk siap menghadapi dan memanfaatkan peluang serta mengatasi tantangan di era ini. sebagai yayasan yang berkomitmen untuk meningkatkan kualitas kesehatan, kami berbangga menjadi tuan rumah acara ini. Seminar internasional ini bertujuan untuk menjadi wadah bagi para profesional kesehatan, akademisi, peneliti, dan praktisi di bidang kesehatan untuk saling berbagi pengetahuan, pengalaman, dan pemikiran terkait kesiapan mereka di dalam menghadapi era society 5.0. Di dalam acara ini, para pembicara terkemuka dari berbagai negara akan memaparkan pandangan mereka tentang tantangan dan peluang yang dihadapi oleh para profesionalisme kesehatan di dalam era ini. Mereka akan membahas peran teknologi, digitalisasi, dan inovasi di dalam meningkatkan pelayanan kesehatan serta berbagai mengatasi hambatan dan kekhawatiran yang mungkin timbul. Seminar internasional ini juga menyediakan platform yang luar biasa bagi peserta-peserta untuk berinteraksi, berkolaborasi, dan membangun jaringan profesional yang luas melalui diskusi dan pertukaran gagasan. Kami berharap para peserta dapat memperkaya pengetahuan mereka dan memperluas pandangan mereka di dalam menghadapi tantangan masa depan. Kami juga ingin menyampaikan apresiasi yang tinggi kepada Universitas YPIB Majalengka dan semua pihak yang telah mendukung dan berkontribusi dalam penyelenggaraan acara ini. Terima kasih kepada para pembicara yang telah meluangkan waktu dan energi untuk berbagi pengetahuan mereka. Terima kasih pada seluruh panitia yang telah bekerja keras di dalam persiapan acara ini. Terima kasih kepada para peserta yang hadir dan bersedia berbagi pengalaman mereka. Demikianlah sambutan ini. Kami sampaikan mohon maaf apabila ada kesalahan. Semoga YPIB semakin maju dan jaya di dalam semangat kerjasama dan inovasi. Kami yakin bahwa dengan seminar internasional ini akan menjadi tonggak penting di dalam peningkatan kesiapan para profesional kesehatan menghadapi cara society 7.5. Harapan kami, mari kita bergandengan tangan untuk membangun masa depan yang lebih baik di dalam kesehatan, terutama dalam bidang keperawatan, kebidanan, dan kefarmasian. Sebelum ditutup, kami akan menyampaikan, I saw a big eagle, so I took a picture. School is a struggle to achieve the future. Aku melihat seekor elang yang langsung aku abadikan. Sekolah adalah perjuangan untuk mencapai masa depan yang cerah. Billahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you. Thank you for Mr. Satmaja for the welcome speech. For the following, we have an opening remark from the Rector of Universitas YPIB Majalengka. Please welcome Dr. Wawan Kurniawan, SKM SKAP Nars MKes MKAP. The time and media is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin, wassalatu wassalamu ala asrofil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in, amma ba'd. First, our chairman of the Imam Bonjol Majalengka Education Foundation, Mr. Satmaja, Bachelor of Arts. Second, our Vice Rector, Deans and Heads in Study Programs of YPIB University. Our distinguished speakers from Philippines, there are Heldi and Ligues and Maria Donabel Umadai. From Malaysia, Dr. Nahlah. From Kingdom of Saudi Arabia, Dr. Ahmad Turki, and all the participants. I would like to begin by expressing my gratitude to Allah Subhanahu wa Ta'ala for His grace, taufik, and inayah, allowing us to gather here today in good health for the international webinar on July 15, 2023. The webinar focused on the theme Readiness of Healthcare Professionals in facing opportunities and challenges on the workforce towards the era of Society 5.0. Extending sincere thanks to the head to the committee and the academic community of YPIB Majalengka University for organizing this event, and I hope it proceed smoothly to its successful conclusion. YPIB University is one of the higher education institution in Majalengka Regency, has the vision to become a leading university in the development of science based on Islamic values by 2030. The university is continually striving to enhance in quality and relevant and become distinguished institution that is independence and culture. Society 5.0 represent on concept of a human-centered and technology-based society. In this era, our society is expected to address various social challenges and improve the quality of human lives by harnessing the innovation bordering in industrial revolution 4.0. Education plays a pivotal role in enhancing the quality of human resources for both educators and students in the era Society 5.0. Students are expected to processing the first skill on the 21st century: creativity, critical thinking, communication, and collaboration. Educator on the other hand should leverage the essential aspect, the internet thinking, IoT, virtual or augmented reality, and artificial intelligence, or AI to identify and cater to the learning of other students. Hadirin yang saya hormati, izinkan saya menggunakan bahasa Indonesia. Society 5.0 bertujuan untuk mengintegrasikan ruang maya dan ruang fisik menjadi satu sehingga sesuatu menjadi mudah. Universitas YPIB mengharapkan calon-calon tenaga kesehatan, tenaga perawat, tenaga farmasi, kebidanan menjadi profesional mandiri di bidangnya. Dengan adanya sistem Society 5.0 akan menciptakan sebuah tantangan baru di berbagai sektor, salah satunya adalah sektor kesehatan yang saat ini tenaga kesehatan dituntut mempunyai skill yang mumpuni, bagaimana dia mengembangkan nilai karakter yang kuat, empati, dia bisa bertoleransi yang memang harus dipupuk seiring dengan perkembangan kompetensi. Kita sebagai calon tenaga kesehatan dan rekan-rekan yang saat ini hadir yang memang sudah bekerja, itu harus berpikir kritis, kemudian inovatif, kreatif, dan keterbatasan kompetensi serta skill itu akan mempengaruhi peluang kerja di bidang kesehatan. Dan memang secara hukum alam, rekan-rekan yang memang sudah bekerja, kalau kita tidak berpikir kritis, inovatif, dan kreatif, mengembangkan karir sebagai tenaga kesehatan, baik farmasi, keperawatan, kebidanan, dan profesi-profesi yang lain, maka akan berpengaruh pada kinerja kita. Maka institusi pendidikan mempunyai revolusi perubahan dan berorientasi pada pembelajaran yang lebih modern, bagaimana menyiapkan lulusan Universitas YPIB Majalengka menjadi tenaga siap pakai yang profesional, mandiri, dan yang penting adalah bagaimana beradaptasi dengan teknologi. Kami atas nama Lembaga Pendidikan mengaturkan banyak terima kasih kepada para narasumber, teman-teman yang begitu luar biasa, mahasiswa, baik dari keperawatan, kebidanan, farmasi, yang begitu luar biasa hadir pada kesempatan hari yang berbahagia ini. Ketua BIN4 Edu yang telah memfasilitasi kegiatan ini, terima kasih. Dan para narasumber, kemudian pendukung kegiatan yang saat ini kita lakukan, kami haturkan banyak terima kasih. We sincerely have this international seminar serve as a platform for knowledge transfer to students, educators, and healthcare workers. Enjoy your participation in the webinar and may is being valuable benefits to all of us. Amin ya Allah ya Rabbal Alamin. Terima kasih. Mohon maaf bila taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Up, we are going to have a read, which will be guided by Mr. Ujang Permana, as MSE. So, Mr. Ujang, the time and media is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, good morning, sabau khair, maganda umaga, dan salam sejahtera bagi kita semua. Hadirin yang berbahagia, marilah kita berdoa dengan khusyuk menurut keyakinan masing-masing. Izinkan saya akan memandunya secara agama Islam. Marilah bersama-sama kita menundukkan hati, memohon ampun, seraya mengharap agar doa kita dikabulkan oleh Allah Subhanahu wa taala. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Hamdan syakirin, hamdan naimin, hamdan yuwafi ni'amahu wa yukafi majidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karim wa 'azimi sultani. Wassalatu wassalamu ala asyrafil mursalin wa ala alihi wa ashabihi ajma'in. Allahumma sholli ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Amin ya Allah ya Rabbal alamin. Ya Allah ya Rahman ya Rahim. Pada hari yang berbahagia ini, hari Sabtu tanggal 15 Juli 2023, kami berkumpul dalam rangka acara seminar internasional yang diselenggarakan oleh Universitas Yayasan Pendidikan Imam Bonjol Majalengka. Semoga acara ini berjalan dengan lancar, memberikan manfaat, dan selalu berada dalam ridho-Mu. Ya Allah, ya Tuhan kami yang maha mengetahui, limpahkanlah kepada kami semua kekuatan dan kesabaran, kemudahan dan keikhlasan, serta kecerdasan dan kearifan, khususnya seluruh peserta seminar internasional, baik mahasiswa, para profesi, bidan, perawat, atau profesi yang lainnya, para pendidik atau dosen, panitia, narasumber, dan seluruh yang terlibat dalam kegiatan seminar internasional ini. Berilah kami ilmu yang bermanfaat, kepahaman yang luas, dan amalan yang Kau terima. Berilah kemampuan kepada kami, apa yang kami dapat dari hasil seminar internasional ini, memberikan manfaat untuk kita semua, dalam rangka memberikan pelayanan yang prima kepada masyarakat, sesuai dengan profesinya masing-masing. Ya Allah yang Maha Bijaksana, berikan kepada kami iman yang kokoh, akhlak yang mulia, jadikan kami orang yang beriman dan bertakwa kepadamu, serta pandai mensyukuri segala nikmat-Mu. Ya Allah ya Tuhan kami, hanya kepadamulah kami berbakti, dan hanya kepadamulah kami mohon pertolongan. Kabulkan doa kami, Engkau Maha mendengar, Engkau Maha pengampun. Allahumma inna nas'aluka salamatan fid dini, wa afiatan bil jasadi, wa ziyadatan fil ilmi, wa barakatan fil rizqi, wa taubatan qabla al maut, wa rahmatan inal maut, wa maghfiratan ba'dal maut. Allahumma hawin alaina fi sakaratil maut, wa najata minan nar, wa lafainal hisab. Rabbana atina fid dunya hasanah, wa fil akhirati hasanah, wa qina adzabannar. Wa sallallahu ala sayyidina Muhammadin nabiyil ummi wa ala alihi washabihi wasallim. Subhana rabbika rabbil izzati amma yasifun. Wassalamun alal mursalin. Walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Before we begin the first session, I will express our heartfelt appreciation to the sponsors who have played a crucial role in making this event possible. Their generous support and commitment to advancing healthcare in the Society 5.0 era deserve our utmost recognition. Ladies and gentlemen, for the first and second session of this seminar, allow me to introduce Mr. Ando as our moderator. I will read you the CV. The full name of Mr. Ando is Ando Fikri Hakim, S.Cap Nurse, MAN, PhDN. He was born in Lampung, June 4th, 1987. His gender is male. His full address is in KP Padakasi, RT 7, RW 8, Kelurahan Cibeber, Cimahi Selatan. Kode pos 40531. His cell phone number is 082 317 120 477. His email is hakimandofikri1@gmail.com. His status is married. His nationality is Indonesia. His religion is Muslim or Islam. For his formal education, he He's studying in Doctor Philosophy in Nursing in Philippines Women University from February 2021 until present. From September 2012 until April 2014, he studied Master of Art in Nursing Philippines Women's University. From 2009 to 2010, he studied Nurse Profession Program in Stikas Ahmadiyani Cimahi. From 2005 to 2009, he studied Bachelor in Nursing Program in Stikas Ahmadiyani Cimahi. For the work experiences, he worked as Head of Student Council in Nurse Education Study Program from 2011 to 2012. He worked as Head of Collaboration and Relationship Bureau in Budi Luhur Institute of Health Science, Cimahi from 2016 to 2018. He also worked as Head of Career Development Center Bureau in Budi Luhur Institute of Health Science, Cimahi from 2018 to 2020. He worked as Vice President for Collaboration and Relationship Affairs in Budi Luhur Institute of Health Science, Cimahi, from 2020 until present. He's also worked as organizer member of Review for Prometric Examination from 2017 until 2018. He worked as facilitator of review for Prometric Examination from 2017 until 2019. For the last one, he is working as a reviewer of Prometric Examination from 2019 until present. So, without further ado, please join me in welcoming Mr. Ando to the virtual stage. We eagerly await his guidance and look forward to a session filled with enlightening discussions and valuable insight. So, Mr. Ando, the time and media is yours. Please take the stage.
Okay. Thank you very much everyone. Good morning, selamat pagi, magandang umaga sa inyong lahat po. Magandang umaga sa Ma'am Henlin Atanasio. Okay, this is the webinar of YPIB University Majalengka. Today we will have speaker from Manila Central University. Allow me to read the curriculum vitae of Ma'am Henlin Atanasio. Okay. Name of the speaker is Henlin Enriquez Atanasio, registered nurse MAN, Master of Art in Nursing. She's have address in 14 Camia Street, Potrero, Malabon City. This is her mobile number and her home number, also email address. So the participant, if the one will be sending email, you can send through this email. Academic qualification, she's graduate school in Holy Angel University, Angeles City, Master of Art in Nursing from 2008 until 2010. Then tertiary, it's University of the Assumption, Unisite Subdivision, City of San Fernando, Pampanga. Bachelor of Science in Nursing from 2003 until 2007. Then secondary is Gua National National College, Pampanga from 1919 until 2003. Then for primary in Bangkal Elementary School, Pampanga, in 1993 until 1999. She is as a registered nurse passed Philippine Nurse Licensure Examination on June 2007 with license number 0441353. And then she have professional work experience on August 2002 up to present as Associate Dean for Student Welfare and Support in College of Nursing Manila Central University, EDSA, Caloocan City. Also, from November 2012 up to present, she's as clinical instructor, area of specialization of maternal and child health nursing course audit, anatomy and psychology, medical surgical nursing in Manila Central University also. Then on November 2008 up to October 2012, she's have clinical instructor in Philippine Rehabilitation Institute, and September until November 2007 and 2008, School of Nurse in San Michel College, Pampanga. She have also have a lot of professional growth and scholarly work. I will not read one by one for the effective time. So let us let us hearing for the speaker, Miss Henelin Atanasio, as first speaker. Time is yours.
Thank you very much, Sir Ando. So let me share my screen. I would like to ask, can you see my screen already or no?
Yes, that's still process. There, yeah, there is. Meron po.
Thank you, sir. Can you also hear me clearly?
You are audible now.
Thank you, sir. So good morning, everyone. To my fellow speakers, to the organizing panel and officials of University YPIB, excuse me, and to our dear faculty members and students of different nursing schools, to our very own Manila Central University, Dean Melvin D. Miranda, a great morning to all of you. So it was a good day to present to you this talk about how healthcare professionals are ready to face the challenges on the society of 5.0 era. So let me continue. So let's just have first a very short activity. If you can go to your browser, kindly go to menti.com and use this code to join this very short activity. So please go to menti.com and type the code 73620623. So while waiting, I would like to thank you for this opportunity to share with you about this readiness of the healthcare professionals for this society of 5.0 era. I would like also to acknowledge my fellow clinical instructors at Manila Central University, Ms. Rostin Mariano, Dr. Cyril Consuelo, and our dear students. So I think, have you already joined the menti.com? So just go to menti.com, or if you couldn't go to that website, you can type your answers in the chat box So the question is, what is your idea? So let me share to you the answers of those who had participated in this very short activity. Can you see it? Can you view the
Yes,
slide
ma'am.
for Menti?
Yes, ma'am.
Thank you. So what is your idea about Society 5.0 era? So one mentioned it's humanity's well-being, sustainability, information society, nursing, artificial intelligence. One mentioned also, it may talk about a system, it may talk about the world, it may talk about balanced economy. It's very informative, technological advancement. And so as I can see, you already have a very good idea of what is the Society 5.0 era. So thank you for your responses. So you can continuously share your answers on menti.com. And as I continue with my talk, so let me share with you what are the objectives of this talk or webinar. So first is we have to define what is Society 5.0 era. So upon the invitation of our beloved Dean Melvin D. Miranda, I've asked him what is the theme or title of this webinar. So it's preparedness, right, of the healthcare professional towards this Society 5.0. So at first, you would have the question, what is the Society 5.0 era? So we have to define it first. And then I'll be showing you an overview of the present healthcare challenges. So this one is globally. And the last one would be the highlight of the best practices and opportunities in preparation for the Society 5.0 era. So you have mentioned during the Menti activity at the menti.com, what is your idea? What is your thought about the Society 5.0 era? So this one is an overview. So we have started with Society 1.0 wherein there's hunting, right? There's gathering, and there proceed with the agriculture of the Society 2.0. And there comes the Industrial Revolution wherein it talks about Society 3.0. And now the current era that we are into, which is Society 4.0, the information age. And now we're gearing towards the new society of Society 5.0. To further understand what is this about, we have here a diagram from CAO Japan, wherein in the current society, knowledge and information are not shared and cross-sector value is difficult to create. So there are a lot of big data, Internet of Things, right? Artificial intelligences. So this is the current Society 4.0 that we are presently into right now. So when it comes to Society 5.0, the Internet of Things will connect all people, all things, and all sorts of knowledge and information to create a new value for these things. Another illustration is that at the current society, there is a variety of constraints that exist with respect to social problems such as the aging society, the regional depopulation, making a sufficient response very difficult. So with the goal of Society 5.0, the social issues will be overcome and humans will be liberated from these various types of constraints. The next one, the third one would be the possibilities. The current society right now is that people do have a large amount of work, right? Physically, so their abilities had limitations and the behavior of the physically challenged is still constrained. Gearing towards Society 5.0, the possibilities open to humans will expand. So through the use of robots, such as, and also automatic driving cars and other innovations. And the last illustration talks about today that there is an overflow with information. Do you agree with that one? we would just type in Google this word, and then there are a lot of information that could be derived from that search. So there's an overflow of information. So the work of finding and analyzing this information desired is quite difficult and burdensome. So for the Society 5.0, the AI or the artificial intelligence will free the humans from that burdensome work of analyzing huge information. From this analyzing this huge information. So if you are going to check on this one, 5.0 would be more of the human aspect. So this one was coined by Japan. Society 5.0 was first proposed by Japan. So they are gearing towards wherein there is human-centeredness with the use of this technology. So the social reform and innovation of this 5.0 society would achieve a forward-looking society that breaks down the existing sense of stagnation. So a society whose members have mutual respect for each other, transcending the generations, and a society in which respect and every person can lead an active and enjoyable life. So that is quite promising, right? So after discussing to you what is Society 5.0, I'll be presenting to you the challenges in the healthcare system. So according to Walters Clower in September 22, there was an article which published the different challenges the healthcare society is now facing. The first one is elevating and standardizing the care. So what is this one? So this one is providing quality and equitable standard of care continues to be a challenge for many countries, specifically financially related. So everyone would attest that the pandemic had truly brought everyone financial constraints. So the elevation and the standardization of the quality of healthcare is now a challenge for most of the countries. The second one is optimizing clinical workflow. So what is this clinical workflow? So when even though there are tools available such as the electronic health record, if it is not fully optimized, the workflow could also be constrained. The third one, and I believe we are all agreeing with this, there's personal shortages and burnout. So later I'll be showing you the present Philippine situation about the personal shortages and burnout. So it was highlighted according to the International Council of Nurses, it estimates a global shortage of 13 million nurses by year 2030. So burnout plays a major role, especially as the pandemic continues. However, another factor sets in, and this is the aging workforce. That is why there was a predicted shortage of the nurses by 2030. And the fourth one is keeping up with the advances in medical science and information. So breakthroughs in digital medicine, gene therapy, nanomedicine, and other researches are also emerging. However, the challenge on this one is that these innovations are outpacing the hospital's ability to keep up. So not all institutions or facilities could keep up with these innovations. And then the fifth one would be an advancing health equity. So the availability of the healthcare services to all people, regardless of their race, regardless of their social status, could be a continuous challenge in the healthcare system. And the last one, a very present challenge, is the patient safety. So these may include medication errors, diagnostic errors, which always been a formidable challenge for all health systems and leadership. So how can we address these challenges? So I want to share to you the Philippine health workforce at a glance. So for the category 1, where we belong, the health service provider. So these are healthcare professionals. So this was derived from the Department of Health. So the public and private practitioner, whether formal or non-formal personnel, may include physicians, the nurses, the midwives, the dentists, the medical technologists, pharmacists, and other healthcare professionals. So in the Philippines, we are gearing toward building a talent pool of health professionals in the digital era. So how could we do that? So nationally, the Department of Health, why are they building this talent pool? So because there are different issues on adequacy and distribution. And then how are they going to build this talent of pools of health professionals in response to this Society 5.0? So we have here the Sustainable Development Goals, or the SDG. You're all familiar, right? So we have the different SDGs. So these SDGs, also known as the global goals, so they are a universal call to action to end poverty and protect the planet and ensure that all people enjoy peace and prosperity. So the third among the SDG is good health and well-being, and this is our focus. So the measure of achievement of this particular goal is by achieving high coverage for the 12 selected health indicators. So as mentioned here, an estimated composite index threshold of 44.5 doctors, nurses, midwives per 10,000 population is needed to reach the minimum. However, from reality, this is yet to be achieved. So how to build a pool of healthcare professionals? So the first one strategy would be adequacy. So there should be a right number and equal distribution of healthcare professionals across each locations. The competence is another important thing, wherein the knowledge and skills on the universal healthcare and the knowledge and skills on the specialty area. So trainings are a must on this part. Of course, everyone looks for a decent work, wherein there should be a fair income, a security in the security in the employment, and a safe working conditions. So these are the proposed strategies on how to build the pool of healthcare professionals. So from the challenges to the strategies and opportunities in relation to this 5.0, how does technology affect nursing? So are you ready for those innovations that would really affect nursing? The first one is through monitoring. So these innovations have helped us. So I believe at some point on your nursing career, you have used these monitorings, right? We have here the cardiac monitors, portable monitors, wherein the nurses could check on patients quickly, that we don't need to go to the patient to check manually, right? Because there are different tools already available. So nurses receive an alert if the patient needs urgent attention or there's a significantly reduced in the response times. So these monitoring devices, innovations in these monitoring devices have truly helped nurses. So another innovations is through the area of medication administration. So nurses in most healthcare settings no longer need to make rounds to monitor patients' IV, as smart pumps allow for more accurate and efficient administration of medication. So we have here the syringe pump, the infusion pumps, okay? And this technology set how much each patient should receive, while alerts and notifies them if there will be a low level, poor patient reaction, and issues with Juli. So this would save time, right, and effort of nurses. And at the same time, it helps nurses to work efficiently with the patient. The health record. So since we are on the digital age, so these are the emerging use of the EMRs, or the electronic medical records. So nurses and other medical professionals can quickly access critical patient information and reduce or eliminate the need for paperwork. Because on the past years, most of the time was consumed doing manual charting, they fill out the information through those papers. So electronic records are of great help nowadays with nurses. So the EMR also gives nurses the current data and notifies them as the patient's condition changes. So that is why our course, Nursing Informatics, truly help nurses as they utilize these health records, electronic health records. The beds nowadays, so the innovation of beds, we call them the smart beds, which allow the nurses to monitor patients' movement and even vitals, which could help prevent bed sores, injuries, or misdiagnosis. So this technology-enhanced beds also reduce the amount of the time nurses spend on adjusting the equipment. So can you recall experiences when you have used beds wherein you would manually, when you're trying to elevate, okay, put your patients in high Fowler's or semi-Fowler's position. So we would do manual, right? Adjustment of the bed. So with this innovation, the smart beds, we would just, in one click, you could adjust the height or the position of the bed. So another innovation is this one. Earlier, I've presented to you, right, the challenges. One of the challenges is about patient safety. So with the help of this innovation, it has come to reduce errors in patient medication. So technology considerably reduces the likelihood of error through logging the patient's information, such as allergies to medication, medical history, or health conditions and illnesses. So there are different apps which could be found on our smartphones or even on the information system of the hospital, wherein the administration of medication could be more effective and less confusing. So this in turn improves and reduces hospital admission rate. Communication. This old-fashioned skill that a nurse should possess, right? A very good communication skill. So even without technology, we have utilized already this one, the verbal, the non-verbal, the use of therapeutic communication in nursing, right? However, with the use of this digital age, communication could be enhanced further because of the different tools, such as instant messaging. Headsets would allow communicate with their colleagues in real time. So if we have our smartphones wherein we could, their message could be received instantly by all members of the healthcare team. So these tools make coordination of care much easier, and they reduce the time which would require access to test results. So the manual waiting of that test results for 1-2 days could be easily accessed through these digital tools nowadays. So this improved communication and also provides more efficient patient handover between different departments of the hospital. And this has become prominent during the pandemic, right? How many of you have experienced or have encountered telehealth or teleconsultation, since we cannot go out during the pandemic, right, to seek consultation? So we did telehealth or telemedicine. So patients can increasingly access medical professionals, including nurses, at the comfort of their homes. So thanks to these mobile applications, thanks to this innovation, so nurses advise patients on many health concerns, while the patients update their own data through these applications so that the medical professionals can best monitor their conditions. But nowadays, for the past months or years, slowly we're going back to that face-to-face consultation. But this telehealth already is part of the healthcare system. So that's it for the healthcare. May I go on with education? Since I am working in the academe and the setting of Manila Central University in the Philippines, so I'll be sharing with you the opportunities that we have in preparation for this 5.0 society. So education 5.0, if we would name it. So this is the use of technologies to provide more humanized teaching with a focus on students' social and emotional development and solutions that improve life in society. This is according to Seidel. So this education 5.0 is the future. So this one is to turn digital transformation into a tool for social transformation. Earlier, I have explained to you the society 5.0 era, right? And in relation to education, we are going to use these tools for social transformation as well. So this is a chain that links digital and technological knowledge to human, social, and emotional skills to promote well-being. To emphasize, Society 5.0 era focuses mainly on the human individual, on the human well-being. So with the use of this tool, so there was a fear before, right? That are we going to be replaced by robots? Are we going to be replaced by these artificial intelligences? Maybe at 4.0, that was the question. But to answer this, at 5.0, they have formulated this 5.0 wherein there's still a human touch, wherein there is human-centeredness on 5.0. So to further understand when it comes to education, let me present to you the present situation that we have wherein there's education 4.0. So it promotes speed, accuracy, and knowledge in instruction. So there are different digital tools, right? So we have also the e-books, right? Before, during our time, when we're still studying, we're carrying a big bag full of books, those hard copies of books, nursing books. But nowadays, with the smartphones, they could easily install these e-books, even with nursing. So the industry 4.0 technologies, the Internet of Things, artificial intelligence, machine learning, even the use of games. So later I'll be showing you some tools that we are using in learning. So these are already available now at 4.0. And the goal is to bring education close to technological advances already used by the society and companies. For our goal of education 5.0, it is the outgrowth of idea of 4.0. But it would not fully eliminate what is present at 4.0, but it would add more human perspective to learning. And this is what I want to highlight with you. With 5.0, there is human perspective to learning. So this includes social and emotional abilities in order to promote lesser environmental impact, but with greater health and safety. So we would not put human into lesser. It would not overshadowed by this technology, but human perspective could still be the focus and the main focus of 5.0 era. So what are the benefits of this education 5.0? So there's collaborative work. So more opportunities for every individual to present their ideas, to present their perspectives through this education 5.0. So there's also better interpersonal relations and empathy and tolerance of diversity. In creativity also, may further be enhanced on this era. Conflict management as well, and more fluid communication with the use of technology. So these are the benefits of Education 5.0. So how can we apply 5.0 in educational institutions? There were two emerging important factors. The first one is investment in educational technologies. So these are the use of learning management system, and of course, the person who would be the facilitator of these educational tools, the teachers, we, the educators. So trainings are very much important. Yan. How many of you have used these applications? Probably you're familiar, like what we are using now, Zoom, right? Zoom, we have Google Meet, we have different tools that we have used for our online learning. The pandemic had brought this online learning into a reality. So before it was just a part, some would just, very few individuals or even institutions have utilized this online learning. But with the pandemic, everyone got to experience this online learning with the use of these tools. So let me share with you some of the practices or opportunities that we have right now, and that could be enhanced further in preparation for Education 5.0. So this is our learning management system at Manila Central University. So we are putting here all our resources, such as the videos, links, websites, our PowerPoints, and even the assessment tasks of students, such as quizzes. So there would be Dropbox there wherein they would be submitting all their requirements for the course. So each course has this interface. So this is our learning management system. During the pandemic, as I have mentioned with you, we were able to utilize online learning. So we have here the written demonstration of students, the checklist presented as they do their written demonstration for the different nursing procedures. The next one are the different activities. So with the use of online learning, the teacher's training is important. And for Manila Central University, we had this what we call the PAHAM training, wherein educators were trained for several weeks. Innovations on the tools, on how to use this tool, on how to deliver the classes, the introduction of flipped classroom, the introduction of flexible learning, high flex learning. These were all introduced in the training. And one I have utilized during my class was the Think, Pair, Share. So wherein students were in a breakout room with their pair, two students, and then they would be thinking, or they would do brainstorming for certain guided questions. And after that, for 30 minutes or for 1 hour, they would go back to the main room and they would be sharing what they have discussed during their breakout rooms. So the Think, Pair, Share. So we have also utilized group dynamics during the online classes, where in this time, they are not in pair, but they are in groups. So we have also presented different case-based scenarios, wherein even if it's true online, we have utilized this group dynamics with the student. They use the technology, how technology have played an impact on this online learning. So even a face-to-face classes, we will be using whiteboard, we would be using chalkboards. So thank you, Zoom, for these features that we could also input our additional information during the discussion to our students. So these are all part of the Society 4.0. Another tool that we have used, the Wheel of Names. So this one was used for the oral questioning or the graded recitation. So students would see their names, and once their names called, they would be answering the question. So these are all part of what we have done during the online classes. Even the checking of nursing care plan was also done during the online classes. For the skills laboratory, so that was mostly for lecture part. For the skills laboratory, we have the virtual laboratory. So we have videos presented and also the actual simulation laboratories for our nursing students. So we have all the dummies, we have all the tools that they could use to further enhance their nursing skills in preparation for their related learning exposure. I just want to share with you also that during the online classes wherein related learning exposure is not feasible physically, we had the nursing virtual platform. So we have in cooperation or in coordination with Asian Hospital. So we had here the virtual platform sessions wherein they would be letting us see what is found inside the hospital for our nursing students. So that's it. So thank you for listening, and I hope you have learned from what I have shared with you as we all prepare for Society 5.0 era.
Thank you very much, Miss Annalyn, regarding your topic this morning. It's such a brief topic regarding for preparing of Society 5.0. Like you mentioned before, we can see for the different of Society 1.0, it's regarding for hunting and gathering. Then 2.0, it's like agriculture. 3.0, it's about the, I mean that it's industrial, and 4.0, it's in Internet of Things. Then now we preparing for the 5.0. It's very challenges for us actually, not only in Indonesia but also in the Philippines right now. So like you mentioned, it's what kind of the benefit of the 5.0 in education. It's like collaboration work, better interpersonal relationship, creativity, and conflict management. We need to know about that. Then now let us waiting for the from the audience, from the student, faculty, or health professional who will have asking regarding for this 5.0 society. There is question from the participant, ma'am. May I read for first question? It's post the COVID-19 pandemic will greatly affect the entire health system. Are there any obstacle when developing healthcare system method in society 5.0 in the Philippines, and what are the solution? You can answer directly, ma'am.
Thank you, sir. So for this question, so as I presented earlier to you, the present situation of the Philippines, the Philippine healthcare system. So there's truly challenges. There are truly challenges that become obstacles in achieving this society 5.0. However, the Philippines, the government with the help of the different organizations, especially the Philippine Nurses Association, they are continuously strategizing different efforts, putting all their best practices so that the Philippine healthcare system could probably be one step ahead in preparation for this society 5.0. So the utilization of the different technologies, since this is a quite a multifactorial, there are different factors that could really help in achieving this full implementation or the full achievement of the society 5.0. However, these small steps that were already started could somehow help more the Philippines to prepare in this 5.0 era. So nowadays, we're slowly going back to the face-to-face consultations. So although telehealth medicine is still part, so slowly we are going back to what is practice pre-pandemic.
So we need to one step ahead, right? You're mentioned, right, ma'am?
Yes,
Yeah.
sir.
Okay, that's good. So also because of effect of COVID-19, we're still using it's like technology like telehealth, like you mentioned before. Yeah. Okay. Before we excuse me, before I read another question, maybe there is some participant raise hand. Maybe first from Giga Atsmi Permana, you can ask to Ma'am Henelin, please. You can turn on your microphone or your camera for asking question to Ma'am Henelin. Please, Giga Asmi Permana. Giga Asmi Permana, the one raise hand from the participant. Okay, while waiting, I will read the question here from Sophie Soliha. I'm Sophie Soliha, nursing student from YPIB Majalengka University. I would like to ask you what trick and tips are easy to understand or learn that we as health professionals should be prepared for what kind of challenge to society 5.0 era, as whole people are hard to follow or how to a little disconnecting when we go into the field to prepare that. So you can answer this question, Ma'am Henelin.
Thank you, sir. So for this question, so as a nursing student, so how could you prepare for this society 5.0? So since maybe in the near future or in few years, this would come to a reality and you could be part of this one, right? So as early as now on your studies, with the society 4.0 that we have mentioned, we are already utilizing this technology, we are utilizing these tools, right? We are already familiar with these different innovations. So society or education 5.0 would particularly emphasize the human perspective. So on this part, as you prepare, it is very important that you yourself, you would know how to properly utilize these innovations, because there is still the importance still relies on the human perspective. So it would not of these technologies would not overshadow what the human person could still do, especially to us nurses. No robots, no artificial intelligence could replace nurses. However, we could use these AIs, we could use these digital tools to work more efficiently to give the best patient care to our patient.
I agree with you, ma'am. Because robot or artificial intelligence, they doesn't have heart because human have heart for preparing of that, then can give care to the patient. Is that correct, ma'am?
Yes, sir.
Yes.
Definitely.
Yes. Yes.
The hard part.
Yes. Yes. Po.
Thank you, ma'am, for
Okay, please.
answer my question. But one question to do what the permission to ask again. I think if you consider the technology, there is a negative impact. What to do? Negative impact for
Oh,
technology. 5.0.
okay.
Okay.
This is Sophie,
Thank
still
you.
Sophie Soliha, right? Or another participant? Okay. The question is negative impact for the technology, ma'am, for relevant to 5.0 era.
Yeah, thank you, sir. Thank you, our dear student. So yes, behind these benefits of all this technology, there are somehow downsides or negative impacts. So one is the breach in the data privacy of individuals. So we all know this one, right? So we all have our social media accounts. So the use of these electronic mails. So the privacy of the individual is truly at stake on this part, or on the digitalization of the different age or eras. So that one would to address this one, however, we have rules, we have law rather, that would govern the data privacy of each individual.
Okay,
Okay,
ma'am.
thank you.
Thank you.
Okay, okay, okay. Before I read another question, there is participant also raise hand. Let us to Sophie Soliha. Sophie Soliha. Oh, that's already. R.A. Cynthia. R.A. Cynthia, do you hear me? R.A. Cynthia, you can turn on your microphone and your camera for having question to Ma'am Henelin.
Okay, I will ask about what about countries whose technology is still relatively behind? How do we tell them about the development of this world industry, especially in the world of healthy? Thank you.
Thank you. That's a very good point. How about these countries? So maybe we also belong on this one, the third world countries, as they consider in the Asian countries or the other countries. So with regards to this one, although technology could really be of great help, right? So if it's not yet that fully accessible to such countries, because as I've mentioned on that slides, there are different factors, and one is the financial constraint. So this is again a multifactorial aspect wherein the government would take their part on this one. So as nurses, we would still continue to do, even if it's the old fashion of doing the mechanical adjustment of beds, the monitoring of patient manually. So we could still continue to present that efficient care to our patient, even if there would be absence of these innovations or technology presently. But we're hoping that the government could take their part to access or to invest in this innovation, so we could effectively give more safe and accurate care to our patients.
Okay, ma'am. Thank you so much. It's hard also for private hospital because some of their technology it's still using. It's like you mentioned before. It's like mechanical bed. It's like that,
Yeah.
ma'am.
Yes,
Actually,
sir.
also in the Philippines, still some of
Yeah.
hospitals still using that, right, ma'am?
Yes, sir. Due to limited resources,
Yes,
still,
po.
and we're quite very far from that smart beds yet, not, but because not all institutions
Yes,
are
yes, correct.
have already that kind of beds.
Yeah, exactly for that. So for the if the government hospital they have a lot of it's like grant from the government, so they can uh, provide the automatical bed or another technology using in hospital. Okay, let us continue. Let us continue for a present participant who will asking to Ma'am Henelin. It's from Giga Atsmi Permana. Do you hear me, Giga Atsmi Permana? Okay. How about Cita Vira Nurfadila? Cita Vira Nurfadila, do you hear me? Cita Vira Nurfadila? Okay. Cita Vira Nurfadila, you can turn on your microphone and you can turn on your camera for your asking question to Ma'am Hendelin, please. Cita Vira Nurfadila, are you there? Oh, okay. While waiting, I will read another question. This is from Silvina Julia Utami. Will a health worker face greater challenge in the next few years So how do we balance this, ma'am?
Challenges, right? So these
Challenges.
are always part of a of the human journey while we're here, right? So for sure there would be challenges even with this advancement of technology, or I could say that because of this advancement of the technology, there could be greater challenges. So the key here on how to balance this is the preparation. So like what we're doing now. So with the challenges that is present at 4.0, we could already address strategies. We could already prepare from these challenges that we are presently, that are present nowadays, so that when time comes for the 5.0, for these greater challenges, we could somehow be able to approach this on a smarter mode, since we already have prepared while we are here at 4.0.
Yes, correct, ma'am. I agree with you. Also, this era, it will be moving forward. Before it's 1.0, now
Yeah.
it's preparing for 5.0. So
5.0.
we need to prepare for that. Okay. There is another participant raise hand. It's Martina Intans. Martina Intans, do you hear me? You can turn on your microphone. Martina Intans, are you there? Okay, while waiting, let's us continue. Question from Siti Nur Aisyah. Are there any bad impact in the 5.0 era? So it's like
So
negative impact.
yeah,
I think
so
for
it
the health professional or anything, ma'am.
um yes, sir. So I think the bad impacts in the 5.0 era, so in relation to what we are now, is the same with what we have now at 4.0, is the overload of information, the invasion of privacies of individuals. But somehow we could be hoping that this could already be addressed right now. So they could not post any bad impact in the 5.0 era. But again, we could not prevent any negative impacts as because of these innovations. So again, the key is for us to be prepared, for us to adopt with this innovation.
Okay, thank you so much. It's like in era of 4.0, it's Internet of Thing. Now we're preparing for the 5.0. So it's possible to overload of information like you're mentioned, ma'am. That's correct. Okay. Okay, Martina Intans. Martina Intans, you can ask question to Ma'am Henelin. Okay. I will read another question, ma'am. How can society 5.0 help address complex social issues such as economic inequality and demographic change? That for the question, ma'am.
Yeah. So one of the illustrations earlier, it has addressed the social issues. So 5.0 era gears towards involving each individual with the use of these technologies, with the use of human perspective in relation to the utilization of this digital age. So from that point, if it would involve every individual, there could be equality on the on 5.0 era.
Yeah, that's actually will be have effect. Like we utilize of technology, it's like we said near will be far, far will be near. It's like
Yeah.
that.
Correct.
Okay, okay. Okay. How about Chita Fira Nurfadila? Are you there? You want some ask question to Ma'am Henelin? Hello, Chita. Hello, Martina. Are you there? Okay. Last question. I will read, Ma'am, from Irfan Nur Hidayah. How do healthcare professionals face the challenge that arise from change in the healthcare services delivery, such as telemedicine or the use of wearable device for health monitoring?
So as healthcare professionals, as we have mentioned, we're always flexible, right? We are always adaptive. So these are very important characteristics of healthcare professionals, especially as nurses, as we utilize this innovation such as the monitoring devices. So it is very important for us to have knowledge. It is very important for us to empower our skills, how to use this equipment, how to use this technology, because we could not prevent these innovations as they continue to be bigger, as they continue to give us more and more. So we really have to prepare for this one.
Okay, thank you so much for your answer, ma'am. So I will make it summary for Ma'am Henelin sharing regarding preparing of 5.0 era. That's like Ma'am Henelin mentioned before. It's we need to adapt and we need to prepare for the 5.0. Like we need to utilize a lot of internet of thing technology, what kind of prepare in the hospital, we need to utilize that. So in the effect because of pandemic, we a lot of utilize of technology, maybe some human will be have overload of the information regarding for this era, but we need to make it balance it. Okay, thank you so much to Ma'am Henelin for your expertise sharing. So maybe now we have a certificate for your sharing expertise to our participant. May I call Mr. Wawan as a rector for giving a certificate to Ma'am Henelin. Please, time is yours.
Thank you to Doctors Henely and Riguez for taking the time to share your knowledge with is Indonesia. I'm proud to present a certificate to you as today's speakers. We hope this collaboration continues. Thank you very much, Ma'am Henely. Thank you.
Thank you very much to Dr. Wawan Kurniawan as a rector of YPIB University for giving of certificate to first speaker as our expertise here for sharing of Ma'am Henelin topic. So let us continue with another speaker. Thank you so much to Ma'am Henelin for your expertise.
Thank you very much, sir. Thank you very much, everyone.
Okay. Okay, let us continue. Before we start, I will ask to someone for having some of sponsorship first. Thank you very much, committee. So we will having second speaker, that's from Mahasa University, Malaysia. Welcome to Dr. Nahla Al-Saidi. I will read your CV first before you're sharing your topic for today. Okay, allow me to sharing your CV.
Okay.
Okay, her name is Dr. Nahla Abdul Jalil Al-Sadi. This is for her phone number. If someone participant want to communicate with her, you can call her or email her. Also for the profile, she is skilled epidemiologist and biostatistician and also lecture in research with more than 5 years of experience teaching courses under both undergrad and postgraduate level. Supervised with 23 pregraduate theses and 12 master theses and 3 PhD dissertation published several paper. Her skill is research skill, data management, data interpretation, and analysis, also public health science. There is a lot of also experience, professional experience of Dr. Nahla. It's from 2020 till current. It's as head of community medicine department at Masa University Malaysia. Then 2018 until present or until current, it's coordinator of Master in Science of Public Health at Masa University. Then 2023 until current, it's member of Quality Assurance Committee at Masa University. Also, 2022 till current, it's Problem-Based Learning or PBL committee member as at Masa University. And 2020 until 2022, committee member in continuing medical education at Masa University. And 2003 until 2004, it's medical officer. And 1996 until 2003, it's medical officer and clinical tutor at the pediatric ward, Al Kuwait University Hospital, Sana and Yamin. This is academic qualification of Dr. Nahla. On 2016, she is as PhD Community Health in University Kebangsaan Malaysia in 2006, in Master of Science in Community Health and in University Kebangsaan Malaysia also, and 1996 Bachelor of Nursing in Sana University, Yamin. That's the curriculum vitae of Dr. Nahla Masa University. Okay, for the effective time, so time is yours, Doc, for sharing your expertise. Thank you.
Shall I share my screen?
Yes, Doc, if you available, you can share it.
Yeah, okay. Thank you.
Okay, Doc.
Can you see my screen?
Yes, Doc.
Okay, Assalamu alaikum and good morning, everyone. Today, I think it is like continuation of the previous, from the previous speaker. It will be about the society 5.0 and the preparedness or readiness of the healthcare professionals for this new era. Actually, with this new advancement in the technology, there was a rapid advancement, which resulted in the emergence of new society, which is society 0.5. This society 5.0, I mean, it insisted that the human is centric, or human-centric at the heart of the advancement in technology. And this society 5.0, it will affect the different aspects of the life of human being, and the healthcare is not an exception. Actually, if we want to know what is society 5.0, from my experience before starting this talk, I asked a group of my colleagues, what do you know about society 0.5? And I was surprised that no one of them knows anything about society 0.5.
although we are now on our way to this new society, so it is important to know about this emergent society. So in the history of human being, we go through different societies, starting by the society 1.0, which is the hunter society. Then we went to the agriculture society, then industrial society, then the society which almost we are still living it, which is the society 4.0. In this society, we have which make it easier now or resulted in the emergence of society 5.0, which is the super smart society. So what is society 5.0? It is the new concept. It originated in Japan, and it refers to the vision of human-centered society. So they are putting the human now with the advancements of technology, such the artificial intelligence, the Internet of Things, big data, and so on. So they use these technologies to improve the quality of life of the people everywhere. In the concept of health, or the context of health, the society of life will they will integrate this advancement in technology to improve the health of the population and enhance the outcome of people in an attempt to improve the overall well-being of our patients or our population. So the aims of society is the improvement of the well-being and happiness of the individuals by making them in the center of the advancement of technology. They try to achieve a sustainable development by promoting the already existed human economic growth with the conservation of the environment. They also integrate physical and virtual spaces seamlessly. They ensure that with the advancement of technology, we will take in consideration and respect the privacy, security of data, and the human rights. And they make some trust between the people and organization and so on. It seeks to bridge the digital divide, which means they will try to narrow the gap between those who's having the access to internet and other technologies with those who don't have. So by this, we will ensure the equality between or equity, to provide equity in providing this technology between the different groups of humans, whether regardless to their age, race, group, socioeconomic status, and so on. So these are the aims of society. So the aim is to improve the well-being and quality of life of human being by using this advancement in technology. So here I'm going to mention some of these technologies which can be used in healthcare or already started to be used in the healthcare. So we have the wearable devices like the watch and so on. So these devices try to monitor our health by measuring the vital signs, by setting the appropriate fitness programs and goals for us, and recommending providing some recommendations for our well-being. We have the telemedicine, which is like a virtual communication between the healthcare professionals and our patients. So it will be easy now for those who are living in remote regions or are not able to go to healthcare services. So there will be telecommunication between them, and they can get the proper advice and recommendations from the healthcare professionals. We have the artificial intelligence, and this is the new revolution in the world. Here, the artificial intelligence will analyze the medical images, the medical results, and the health records, genetic data, and clinical data to come up with an accurate diagnosis. Then we have the precision medicine, or the personalized medicine. This is tailored to provide a disease prevention and determination that can take in account the different people genes and environments and other factors that can affect the health of the people. Okay, then we have the social report. The social report is designed to provide companionship and support for the people. And we have lastly the surgical report that enhance the precision and minimize the invasiveness and offer a better visualization during surgery. So these are some examples of the technologies that can be used by the healthcare professionals during the Society 5.0 era. However, this Society 5.0 is very new and may represent many or creates many challenges to healthcare professionals. Here I will mention the most important challenges that can be faced by the healthcare professionals. First, the technological adaptation. So some will be not able to be adapted or to use this technology, and it may become very difficult for them. So they will require continuous learning and upskilling. This is especially in the old generations, which is find it difficult to use these technologies, the current one. So when it would be upgraded, it may be more difficult for them. We have also the data management and privacy. We have there would be a huge amount of data which would be derived from our smartphones, from the internet, and so on. So there will be a lot of data. And so this data will represent a challenge in managing this data and securing the privacy of the patient and keep consideration, ethical consideration in this manner, okay? Then we have the workload and workflow. As I told you, we have the healthcare professionals have a lot of work to do and have a big workload. But now with the new technologies, the addition of the new technologies will increase the workload among the healthcare professionals. Then we have the ethical and legal consideration. There must be integration of the emerging technologies like the robotics and genomics, and this will raise the legal dilemma for the healthcare professionals. So they must navigate issues related to patient consent, privacy, bias in algorithm, decision-making, and accountability. So this also a very, very big challenge which is put upon the healthcare professionals. Then we have the interprofessional collaboration. We will have different various types of technologies which are now will be used in this society. So there must be some sort of collaboration among these healthcare professionals and different health stakeholders, and this would be very important. Especially we have to collaborate with the technology scientists to improve our ability to work with these technologies. Training and education. I repeat it because it is very important for the healthcare professionals to catch up with this rapid improvement and advancement in the technology. So there must be a continuous training and education. So that was for the whole health professionals. I'm now focusing in my midwifery. What is the situation of midwifery with Society 5.0 era? Actually, we can say that midwifery and Society 5.0 have several areas with same alignment, or they can say they have the same concept. They are agreeing in different points and aspects. So, for example, midwifery focuses in providing personalized and holistic care to meet the physical, emotional, and social needs of the women and families before pregnancy, maybe, or during pregnancy, during the delivery, and after delivery. At the same time, the Society 5 emphasize on the importance of human well-being and placing the individual at the center of technology advancement. So both of them are focusing that human well-being is supposed to be in the center of the services provided by the midwifery and the concept of Society 5.0. The second thing is embracing technology. For midwifery focuses in providing personalized holistic care. I mean, they are trying to improve this technology to improve the health of the mother. At the same time, they are using this technology for the society, use this technology to enhance the well-being and quality of life of individuals, while the midwifery is providing, improving this well-being of mothers and their families. The empowering of the individuals, midwifery, the role of midwives actually is to empower the woman and make her and her family able to take the decision about their own health and the decision on the birth experience. At the same time, the Society 5.0 aims to empower the individuals to actively participate in their own health and taking decision about their health and control their own health. Then we have addressing the health inequities. The midwifery defend for the equity in maternal and newborn care. They are addressing the disparities between the different individuals. So they are trying to decrease these disparities and improve the access to a quality care for all women, regardless to their social demographic or socioeconomic backgrounds, their race, or their geographic locations. Similarly, the Society 5, it seeks also to address these inequities among the individuals and ensure that they provide or to the access to healthcare to be available or accessible for different groups in our societies or communities. For privacy and confidentiality, midwifery, the security and the privacy of the mothers and families is crucial. So they are respecting the privacy and confidentiality and providing compassionate woman-centered care, which is also in the heart of the concept of Society 5.0, which emphasizes that the ethical use of technology and data that must respect the privacy and protect the individual human rights. So these are we already talked about the alignments between the midwifery and the Society 5.0, sorry. So how to prepare midwives for this new era or the Society 5.0. First, training and education. Midwives should receive comprehensive education and training to be up to date with this new advancement on technology. This includes understanding the telemedicine platforms, how they can communicate with patients even if they are far from them, and monitoring devices, electronic health records, and AI-assisted decision-making tools. So they have to be very familiar with these devices and these softwares to provide a proper services to their patients. And this can be achieved by continuous training and education about these advancements in technology. Then we have the continuous professional development. This, because I said with the rapid pace of technology advancement, the midwives supposed to be ongoing professional development and give them the opportunities to stay update to the latest developments in society 5.0. Integrated of technology, midwifery, integrating the technology in the curricula of the midwifery. So the curricula for midwifery now should include educating programs that adapt to the topics regarding the technology, data analysis, and digital health. So the new midwives will be now prepared because their education programs now involve these curricula about the technology and how to use it in their work field. Research, the research is very important because when the midwives engaged in these research activities, new data collection methods, and this will result in development or creating of evidence-based practices, which can be used by the midwifery and make them ready for the society 5.0, or it will be easy for them now to move to the society 5.0. So like a wrap-up, continuous education, continuous training, researchers, and update and development of the midwifery will make the midwives ready to the society 5.0. So they will be properly prepared, and they will be ready to face the challenges and to use the opportunities which will be provided by society 5.0. Okay, sorry. So is Indonesia ready for society 5.0? Actually, I just read regarding this issue, and I found that Indonesia is making progress to be ready for the society 5.0. However, they must, mainly the government must conduct a comprehensive assessment of if the country is ready for this society. It requires continuous efforts from the different stakeholders regarding whether the government, NGOs, private sectors, the academicians, civil societies, to create the environment that make the integration of the advanced technologies and the realization of society 5.0 vision of a human-centered technology. So what I say here, that Indonesia is or started to have this enter the society 5.0, but it still need some efforts to be totally ready for this. This may include preparing the healthcare professionals, having some smart hospitals, smart cities, to say that Indonesia now is in society 5.0. So in conclusion, we can say that the readiness of care professionals for society 5.0, it needs a lifelong culture, a lifelong learning, innovation, and adaptability of healthcare professionals. It also requires commitment of evidence-based practice, and they must prioritize a readiness. Healthcare professionals can effectively embrace the opportunities which will be presented by society 5.0, and they will be able to face the challenges which will arise during this era. Regarding midwives, they play important role, a crucial role in supporting women and families during their journey from childbirth journey until after that. So when they have adapted these values of society 5.0, they can contribute in creating a society where technology is harnessed to enhance the well-being and the health outcomes of the individuals. So by this, I am finished my talk. Thank you for listening. Any question?
Thank you so much, Dr. Nahla Al-Saidi, regarding for your topic about preparing 5.0 era for midwifery. So this is an important thing that's midwifery. They need to adopt from the technology curricula for having increasing and adaptation with this era society of 5.0. Okay, let us see for the question from the participant. We have 3 questions from the participant, or have someone raise hand? You can raise your hand for a question. I will read one by one for the question, Dr. Nahla. First, artificial intelligence. This is from Silvina Julia Utami. Artificial intelligence, or AI, in the current health sector can be our virtual assistant in the responding to question and asking about health. Are there other impact if we continuing to depend on AI in the health sector? You can answer this question, Dr. Nahla.
Yeah, this is maybe one of the bad thing regarding society of 5, which is adaptation to this technology or dependent on this technology. So this will be something individual. So maybe by training and the increased awareness of the dangers of depending on technology among the healthcare professionals. So maybe this will help us to decrease our dependence on these new technologies, because it may be good, yes, but it have its side or drawbacks like this dependency, which should be avoided.
Okay, thank you so much your answer, Dr. Nahla. So this is we need to also prepare for that, because not only we use technology, but we need also as human for caring for midwifery, or the one will be childbirth. Okay, another question. It's from Gina Nurlaili Arba. I want to ask, the question is what we can do as health worker in the era of society 5.0 to fulfilling our skill so we can still able to adapt in that era.
Yeah, as I said, that by continuous training and education, yeah, and the development of with the development of technology, we cannot be immediately goes to these different technologies. We have to have more training, continuous training actually, and education. And also, as I said, we can now integrate these in the midwifery curricula to for the society 0.5 era.
Yeah, as you mentioned before, midwifery should be continue education and training, more training for adapt this era. Correct, Dr. Nahla? Yeah. Okay, thank you so much for your answer the question. Next question, it's from Sophie Soliha. Excuse me, permission to ask any readiness. As a public health professional, what kind of system would it be if in childbirth in 5.0? At any rate, given the circumstance circumstance of the mother bear in the sometime unexpected, plus the opening ceremony for the mother in ready to give birth to the baby.
The question is very long. Can you repeat, please?
Yeah. For the question is, what kind of system would it be if the in childbirth in 5.0? At any rate, given the circumstance of the mother bear in the sometime unexpected, maybe it's the mother will be die. It's like that.
I'm sorry, there was an internet connection problem, but what I understand that she wants to say what type of technologies can be used in childbearing situation. Is that the question?
Yeah, according for this, it's like what kind of system we can use for the childbirth in era of 5.0.
Yeah, all the technologies can be used. This can, for example, robotic can be used, the social report for the support, for the companionship also. We can use the telemedicine, which will make it like continuous connection with the pregnant woman and provide her with the information, with the advices she required. And instead of coming to the hospital or the healthcare center, by telemedicine, we can communicate with the mother if she developed any complication, give her the advice to take care of herself. And we can use also the wearable devices so they can monitor her advancement or progress of her pregnancy. So this will make it better for the mother and also for the midwife, for better communication between them.
Okay, so we should preparing for utilize of technology for giving of mother will be childbirth in this era, right?
Yeah.
Yeah. Okay. Anything someone want to ask? Raise your hand. Okay. Is that any someone raise hand? Okay. I will read another question. Here. I want to ask one of the challenge faced by health worker in the era of society 5.0 is the potential to increase of it's like workload of health worker or
Yeah.
for midwifery and disrupt existing workflow. How to overcome this challenge?
Yes, there will be an increase of the workload. Why? Because now we have a big data to manage it. So again, I insist training and education will help us to overcome these problems. At the beginning, it will be overwhelming, yes, but with the continuous education and training, it will be easy for us. Especially for the new generation, it will be easy to learn very fast and overcome this problem.
Okay, thank you so much, Dr. Nahla. Yes, like you mentioned, it's 4.0, it's Internet of Things, so we can looking for a lot of data there, so it could be overload of data, so people we can also, especially for midwifery, can also workload in healthcare, so they need to also adopt the technology for giving the care of to the patient. Okay, anything else? Okay, may I ask permission for conclude your topic, Dr. Nahla? Actually, regarding for your topic, it's midwifery. It's important of healthcare profession for giving a care to the woman and family during childbirth, but they need to preparing for this era 5.0 for taking it's like continue education, training, and so on and so on. So they need to prepare for that, also utilize for the technology. Okay, thank you so much for the sharing expertise, Dr. Nahla. We will have giving the certificate for your expertise sharing to Mrs. Ruri Yuni Astari as Vice President 2 for giving the certificate. Time is your Miss Ruri.
Yeah, thank you. Thank you to Dr. Nahlah, PhD, for taking the time to share your knowledge with us in Indonesia. I'm proud to present a certificate of appreciation to you as today's speaker. We hope this collaboration continues. Thank you very much.
Thank you. It's my pleasure to work with you. Thank you.
Thank you very much for the Dr. Nahla and also committee and also Ms. Ruri for giving the certificate to our expertise speaker from Masa University. Hopefully the topic the participant can also implement in their field of health worker. Okay,
Thank you.
Okay, so thank you so much, Dr. Nahla. Me as a moderator, Ando Fikri Hakim, I will give back to next event or next agenda to Master of Ceremony, Mr. Prizas Dewiana. Please, time is yours.
Thank you, Mr. Ando. Before we proceed further, let us take a moment to express our sincere appreciation and gratitude to our esteemed moderator, Mr. Ando, for graciously accepting the role and joining us in this international online seminar. Once again, a heartfelt thank you to Mr. Ando for joining us. Let us now proceed with the seminar. As we move forward in our international online seminar, it is now my distinct pleasure to invite our other esteemed moderator, Ms. Zahra, to take the virtual stage and guide us through the remainder of this transformative event. Allow me to introduce her by reading her CV. Her name is Zahra Dia. She's a pharmaceutical student. She's a passionate and dedicated pharmaceutical student that is always enthusiastic to learn and undertake new challenges. Her education background. She is studying in YPIB University of Majalengka on Bachelor of Pharmacy. She also studied in Mahad Imam Bukhari High School, completed in 2017. She also studied in Cambridge International School, Junior High, completed in 2013. On the primary school, she studied in Park House English School, completed in 2010. For the work experience, she worked in Mahad Imam Bukhari as English teacher from 2018 until 2019. She also worked in Mahad Imam Bukhari Islamic Education as Islamic Education teacher from 2018 until 2019. For her organization experience, is Pharmaceutical Student Association Vice President from 2021 until now. Student Council Treasurer from 2014 to 2017. And the last one, Student Council Secretary from 2011 until 2013. To Ms. Zahra, the time and media is all yours. Please take the stage.
Good morning, everybody. First of all, may I ask the MC, Mr. Present, is my voice is clear enough? Is my voice clear enough?
Clear.
Yes, ma'am.
All right, let's start. Good morning, everybody. My name is Zahra Dia. I am a senior pharmacy student in YPIB University of Majalengka. Today, I have been given the honor of serving as your moderator for the third and fourth session of the International Seminar, Readiness of Healthcare Professionals in Facing Opportunities and Challenges in the Society 5.0 Era. Moving on to the third session. First of all, allow me to briefly introduce our third keynote speaker of the day, Professor Maria Donabel Umadaydin from the Central Escuela University of the Philippines. Allow me to read a short summary of her biography. Professor Maria Donabel Umadaydin, Education History, Bachelor of Science in Pharmacy, Master of Science in Pharmacy, and Doctor of Philosophy in Pharmacy at the Central Escuela University, Mendiola. Courses completed: the Certified Pharmacotherapy Specialist course at the University of Santo Tomas, the Pharmacotherapy program at the American College of Clinical Pharmacy, the DOSE PCHRD Basic Clinical Practice Training, the Middle Management Development Program, the Dialogue on Innovative Higher Education Strategies International Dean's Course in the Philippines in 2020, the National Multiplication Training by DAAD, and the National Certification Programs by TESDA, which is the Technical Education and Skills Development Authority. Work experience. She is a certified immunizing pharmacist, a coach, and an assessor of the Immunizing Pharmacist Certification Program in the Philippines. She is also the Executive Secretary of the Philippine Pharmacists Association. She is also the Vice President of the Luzon of the Philippine Association of Colleges of Pharmacy. The Philippine Pharmacists Association. Secretary of the Central Escuela University Research and Development Foundation. She is part of the revision of the new practice standards and guidelines for Bachelors of Pharmacy curriculum. She is also part of the core team in the integration of immunization and universal healthcare in the Bachelor of Science in Pharmacy curriculum. She is also a practicing academic pharmacist, teaching at Central Escuela University, Senior High School, Bachelor of Pharmacy, Doctor of Pharmacy, Master of Science of Pharmacy, and Doctors at Pharmacy for 28 years. She is also a developer of teaching materials, syllabus, course plans, modules, and manuals for the Bachelor of Pharmacy program for the university and for PACOP, which is the Philippines Association of Colleges of Pharmacy. She also conducts research, either as a researcher, co-researcher, or a thesis advisor. And right now, she is currently the Dean of the School of Pharmacy of Central Escuela University. And so, ladies and gentlemen, without further ado, let's give a warm welcome to Professor Maria Donabel Umadaydin from the Central Escuela University of the Philippines.
Okay, thank you so much, Sarah, for that kind introduction. So a pleasant morning to everyone. And am I audible?
Yes, Professor, you are audible.
Yeah, thank you. First of all, I would like to say thank you for inviting me to share some of my knowledge regarding your topic. And I will be having my screen shared. Okay, so we have here, the topic assigned to me is on pharmacists facing the opportunities and challenges of the world in terms of the era on Society 5.0. So earlier you were able to listen already to our very able speakers, and they were able to discuss already on some of the topics that I will be I included in my presentation, which is the overview of the Society 5.0, the effects and opportunities of Society 5.0 in pharmacy practice, and the readiness of Philippine pharmacists to Society 5.0. So trying to look at the history again of the Society 5.0, of course, it started with Society 1.0 to 5.0, wherein in Society 1.0, we started with the, in terms of the viability of these processes and going to defensiveness, then functionality, profitability, and now we are gearing towards the humanity. And in humanity, you could see that the society here is considered to be a super smart society. And in terms of productive approach, this will be merging now the cyberspace and the physical space, wherein the materials will now be material 5.0. And this includes different technology now. And if you are familiar with Tesla, wherein these are already autonomous driving. Okay, so this becomes autonomous and decentralized in terms of its applicability, and it would be affecting really the humanity. Now, as I go on to my presentations, I usually give presentations and I base it on research, since in the Philippines, we don't have that full research yet in terms of Society 5.0 to pharmacists in particular. So in a literature review, in terms of the challenges and opportunities of the transition from Industry 4.0 to Society 5.0, it is stated there that if you notice, we are already gearing towards the fifth industrial revolution, wherein part of this is still from the fourth industrial revolution on the 21st century, which we are into now, the cloud manufacturing, cyber and physical manufacturing, circular economy manufacturing. And this already involves the Internet of Things and cyber physical systems and digital platforms, in which most of our students now are into. I really admire the students when they have all of these technologies that help them. So they make use of them as the tool for them to learn more. And we are gearing towards the fifth industrial revolution, wherein it becomes adaptive, it becomes cognitive, in form of sustainable system, as well as human-centric system. And of course, through the pandemic, we all become resilient, and resilient system is already into this. And if you try to look at this in 2025, that is about 2 years from now, there is already an increasing complexity in terms of all of this technology that is happening around us. And in digital and in healthcare, usually the AI in digital therapy or personalized treatment is already affecting most of the individuals in the healthcare system. And if you try to look at this, these are not only pertaining to determination of the diseases or the illnesses of a particular patient in terms of their physiologic and pathologic concerns, but making use of the patient history in a high dimensional set of data. And we make use of the different learning methods. We make use of data analysis. We make use of visualization, and we tend to personalize the medicine. Before, there is a need for us to really bring our X-ray plates, our results to the doctors and to the pathologists or to the healthcare providers in order for them to look into our conditions or look into our disorders. So diagnosis in particular. But now you can see that through technology, we can do already telemedicine, we can do already consultation with the doctors. And likewise, since there is telemedicine, then there will be telepharmacy, which I'll be discussing later. And another research, an investigation upon the 4.0 and Society 5.0 within the context of sustainable development goals. Of course, all of us are aware of the sustainable development goals. And these sustainable development goals really are the guide of all countries in terms of how we deal with the environment, how we deal with our profession, and how we deal with the people around us. And since I'm into pharmacy, I will be focusing on the third one, developing the early warning system for the prevention of infectious disease by combining different types of monitoring data. Just like what is happening now, so the technology really help us in order for us to combat our concern. There's somebody who raised the hand. Yes, Astri. I'm sorry, can I just continue? Can I still be heard?
There will be a discussion session
Okay.
later on, Professor.
Okay,
So
thank
if it's okay,
you.
you can just continue.
Thank you, Zara. Thank you so much. Yeah, so since I am in the healthcare sector, so I will be more of the development of the early warning alert system for the prevention of infectious disease by combining different types of monitoring data. So the technology, the advantage of technology in pharmacy practice is really the ease of obtaining the data that is needed for the different patient that is essential for the assessment. So later I'll discuss it with you. And the challenges and opportunities of era 5.0 and more humanistic and sustainable societies and other research. And based on their study, there is really a relationship between the education, the society, and the industry. So before, if you try to look at the platform of the 4.0, so it's not yet really on humanistic. So this one, it is focused on humanistic, and it really is essential for us to have the education. So earlier, one of our dear speaker already mentioned about this. So education is very important. Education is very important because if you will not adhere to this technology, so trying to look at the two hands there, so that is forming a heart. Yes, you need to have collaboration between the technology as well as the human in order for you to give and provide your services to them. Because until now, I still agree with the previous speaker that we have from the nursing profession and from the midwifery profession, that really you cannot change the services with the technology. Because again, as healthcare providers, our service is a service with a heart. And in order for us to cope up with all of this society 5.0, we need to have that education. We need to have the continuous professional education. We continue to learn. We continue to conduct research. We continue to adhere to this technology and be able to ease the services that we could offer to them. So if you have the proper education and you have the correct industry wherein you are going to provide your service with the support of the government, with the support of the health sectors, of the different organizations, then the society will be the one who will be benefiting for all of this, for all of these services. So the society 5.0, maybe not all of us are prepared, but we are gearing towards that, and education is very important. And trying to look at this society, education, and industry, very important is for us to have innovativeness and a creative society. So as I mentioned in the first slide that I have, this is an industry wherein they are super smart, and the digital transformation should be focusing on the human well-being and the innovation, and the part of our customization of the business model is very important. So therefore, we can make use of the technology as an opportunity in order for us to solve problem in each person, okay, and at the service of the society. However, there is a limitation on that. As I mentioned earlier, in pharmacy practice, we cannot do patient counseling, okay, without human touch, because the emotion that you give to your patient really is different when you do the counseling with them. Even if it is virtually, face-to-face, but there should be still a human intervention. And in education, it really requires social innovation and new skills. And there is a need for us to really update ourselves, okay, in order for us to be equipped with all of this needed technology in Society 5.0. And aside from that, we need to do collaboration, we need to do cooperation, and we need to do experimental work, or we need to do research. So all of us are already introduced into the interprofessional education and collaborative practice. Even in the Society 5.0, we are being prepared through that interprofessional education and collaborative practice. We are prepared in order for us to provide the service to our society with the use of technology. And personalized education would be able to help us solve problems and develop our creativity and critical thinking still. And because of that education, we are equipped with the knowledge and the skills. Therefore, it would be easy for us to put informations on that digital platform in order for others to make use of. So teachers and educational institutions have the capability of sustainability creating new values and services. That's why in the curriculum also in pharmacy, we included already the Internet of Things. We already included also pharmacoinformatics, wherein all of these technologies are being included as part of the curriculum in order for us to adapt with the changes in technology. So now students are into AI. Okay, before you make use of Canva. Okay, you make use of different tools. It's now easy to make PowerPoint presentation. It's now easy to make rubrics through these different technologies. But before, it is really difficult to prepare these slides. So making use of this technology is important. However, there is still a need of human touch in performing our services as pharmacists. Now, dialogue of human and artificial intelligence, wherein the personalization of production and consumption is to be taken into consideration. So individualization of needs and human communication is very important. So trying to look at this earlier, we have the heart of the technology and the hand of the human. This time, looking at the face here, you have here the intelligence of technology, or let's say, for example, our artificial intelligence, and we have the human intelligence. So they should be linked together. So the human and the things are linked in cyberspace and by artificial intelligence. And in Society 5.0, we have here problem solving and value creation. So a society where value is being created. And there are diversity. We have to understand that the society are composed of anyone, okay, of different abilities. And that is the reason why I mentioned earlier that we may be of different abilities. There might be different roles, responsibilities of the different members of the healthcare team. But if we collaborate together, okay, we can work as a group, okay, as healthcare professionals with the use of all of this technology. And in Society 5.0, there is already decentralization, wherein society where anyone can get opportunities anytime and anywhere. Before, you have to carry big books in order for you to read the text. Now you can just purchase ebooks for you to look into, and you can bring it anywhere. You can have your prescription anywhere because there are already online prescription. And resilience is very important, where people can live and pursue challenges in security. However, as mentioned earlier, one of the challenges is still of Society 5.0 will be how to safeguard the personal informations of individual because of the data privacy. And sustainability and environmental harmony, wherein humankind lives in harmony with nature. So this one is important, high environmental impact, and there must be mass consumption of your resources. Now, in Society 5.0, so we make use now of bigger data aside from cloud. So we make use now of artificial intelligence. There is already a high value added information. There are bigger proposals already, or equipment operating instructions or other technologies now, wherein, as I mentioned earlier, there is already automatic producing by robots in the factory. There are AI propose a person, and an automatic driving. So there are different sensor information now that will be essential for environmental information, the different equipment and operating status. So since pharmacy makes use of a practice where in manufacturing of medicine is important, so this could be one of the things that could be seen in Society 5.0, and the people related information and others. And in this one, we could be able to have high quality of lives. There is a comfort on Society 5.0. There is vitality on 5.0. So the concern now is how to balance economics advancement with the resolution of the social problems. So will this be benefiting everyone regardless of age, regardless of gender? Is everybody, every day you are going to live your life happy? Okay, or are there more convenient and safe, secure life, or are people liberated from cyber somewhere? you can have now work from home? Does it provide goods and services and that granularly address your latent needs without disparity, your advanced fusion of cyberspace and physical space? Now, comfort could be there. But again, one of the concerns here is really the security of the data, okay? But in the health practice, again, the heart is very important. How are you going to convince your patient adhere to their medication is important. How sure are we that our patient really take the medication as prescribed? And these are the things that we need to look into. The social issues that will overcome human will be liberated. The IoT or Internet of Things will connect all people and things, all sorts of knowledge, information are shared, and AI will free human from burdensome work, and possibilities of open to human will expand. So this may be very good in terms of some aspects, just like online banking, ordering food through online, data processing, okay? But in health, really, problems may be, let's say, I want to know before symptoms worsen. I want to live happily alone, even in the need of nursing care, as mentioned earlier. So will I go to the AI? Will I go to the artificial intelligence? And I will be getting the medical site info, the environmental data, the medical data, the real-time physiologic data, as mentioned earlier. You just make use of your smartwatch. You could be able to, and your phones, you could be able to monitor your blood pressure. You could be monitoring your BMI, your energy consumption. You could be monitoring your temperature. And what will be its effect? So there could be comfortable living, as we mentioned earlier, reduction of burden, extension of healthy lifespan, because they will be able to detect early illness instead of going to the hospital or to the clinics. Reduction of medical costs, okay, because of the sharing of physiological data and medical data, and reduction of burden in terms of the mitigation of the on-site burden because of the scare of the pandemic, okay, and of course the cost to our caregiver. However, this technology really enables a lot of things. It enables big data, artificial intelligence, adaptive control, as we mentioned, Internet of Things, digital twins. However, in pharmacy, really, we are into telepharmacy already during the pandemic. Because of telemedicine, wherein the patient will have virtual medical consultation, and there will be remote diagnosis, and there will be electronic prescription. Therefore, it's a big concern for the pharmacist to address this patient. And telepharmacy came in during the pandemic. But telepharmacy in the Philippines as practice, we try to converse still with our patient through either Zoom, through Viber, or through technologies, yes, through messaging, okay, through your messenger. However, we really wanted to talk to them more so that we could explain to them more what will be the benefits, what will be the side effects of their medication, how they're going to take the medication. So we wanted to start with the collection of data of the patient. We really need to collect the data of the patient in order for us to properly assess the patient. And if you properly assess the patient, you can plan for the best treatment of the patient. And from there, you could be able to implement that plan. But after you implement, you still have to monitor and evaluate what is the effect of that medication to the patient, in which sometimes we cannot do it in this technology. And robotic dispensing is happening now in other countries. And they can have the dispensing of this medication through the robots. So they dispense medication, they select medication through robots. But again, if it is already patient counseling, there is a need for a heart. So I still believe that heart is important in terms of pharmacy practice. Now, the question is the readiness of the Philippine pharmacists in facing the opportunities and challenges of the world of work towards the era of Society 5.0. We are gearing towards that. So as mentioned in my introduction earlier by Sarah, So I am a member of the Philippine Pharmacists Association. I'm the executive secretary. That is the national organization of pharmacists in the Philippines. And this Society 5.0 is part of our strategic planning. That is part of the education advocacy of the Philippine Pharmacists Association, together with the Philippine Association of Colleges of Pharmacy. That's the organization of pharmacy schools in the Philippines. So in conducting our strategic planning, that is part of the strategic planning. As I mentioned earlier, education is important. Therefore, we are revising our syllabi, we are revising our course plan, integrating all of this technology. Okay, and in order for our students and future pharmacists to be ready. And in terms of the Philippine Pharmacists Association, under this are already the professional pharmacists. So we have several webinars conducting and introducing the Society 5.0 to them already. So some of the pharmacists are already attending seminars, either face-to-face and online, and they are slowly incorporating all of these practices, okay, in Society 5.0. However, in the Philippines, we still see our present scenario that is essential for the type of audience or the type of society that we have. So their attendance to local and international conferences gives them additional information on how to go about this challenges, and they were able to identify the opportunities of doing it. That's why they have started also with telemedicine, telepharmacy, and the interprofessional education and collaborative practice, wherein it is now incorporated in our curriculum. And since we try to revisit the education and practice in the Philippines, so I know by the time that this will be in 2025, this will be already in place and in practice. I think the pharmacists would be prepared as well, because we are already into accepting the different technologies, just like AI, telemedicine, telepharmacy in the Philippines. So for summary, there is a need for us to have a continuous professional education and training to cope up with Society 5.0. And there is an important collaboration. There is a big importance in the collaboration aspect. So there is a need for interprofessional education and collaborative practice. So and we could be able to support all of these opportunities, all of these weaknesses, all of these challenges through research. Because through research, we could be able to identify what are the needs of the society, what are the needs of the healthcare provider, because we have to match what is the need of the society, what is the need of the provider, in order for them to fit with the society. Because sometimes we have this technology, but we need to study our environment. We need to study our society, because we might be too advanced, but the society cannot cope up with it. Say, for example, with telepharmacy, not all Filipinos has the capacity to have that technology to be able to be connected with the healthcare providers. So with that, I have here my references. Thank you so much, and God bless us all.
Thank you very much, Professor Maria Donovan, for giving such informative and interesting presentation. Ladies and gentlemen, we have now come to the discussion session. If anyone has any questions, they may write it in the Q&A section of the chat.
Okay, I saw some questions here. I want to ask something about AI technology in health sector. As we know, AI technology will eliminate many jobs for humans and will replace them. Will AI technology be a big impact on the world of health, and can it be taken over by it? So as I mentioned earlier, we can make use of them as a tool. We can make use of them as a partner. However, I think there is a big impact. However, there is still a need for humans in order to do, say, for example, in terms of dispensing the medication where inpatient counseling is needed, human intervention is still needed for that. There's a big impact, yes, for AI. However, in health sector, there is still a need, particularly in pharmacy, there is still a need for human intervention in terms of the use of the medication. Because not all information that are found also in the net or once you Google it are true. Some may not be correct. That's why we really give emphasis on the proper use of the medication. So I saw another one. Is it okay, Zara, if I will be reading the questions?
Yes, yes, of course.
Thank you. What is the role of us students who are pursuing pharmacy education in facing the current 5.0 era? And how to prepare ourselves in 5.0, especially as pharmacy students? And one more question. Okay, so how are you going to be prepared? So looking into the curriculum, okay, looking into your curricula, I think there is an integration already of technology. And as I mentioned, education does not stop during the time that you are a student. There should be a continuous education. Do not stop learning in the four corners of your classroom or in the four corners of your online class. Please try to attend webinars just like this. I really commend your university for this. Attend webinars in order for you to learn more. So you prepare yourself in this 5.0 era. I think this activity is already one of them that is good for you to be prepared for the 5.0 era. One more question. Can we replace by robot one day as pharmacists? Again, I would say I will stand for our profession as pharmacists. We will not be replaced by robots. We will never be replaced by robots because robots can help us dispense medication, can help us select the medications from the different areas in our pharmacy, but the way we communicate with people will not. That's why in your curricula, you have their communication skills, and that I think is very important. I hope I was able, I am answering your questions. Just let me know if I was not able to answer it. Another question, how to overcome delays in understanding health technology in 5.0, especially in, especially in Generation X, parents like us. I also am a parent of one pharmacist and one who graduated nursing just this year. Before, I really have difficulty also in terms of technology, but you know what? It is important, maybe because I'm a teacher, that's why we continuously go into training. Our university conducts different training on this. So, and also I would be asking my students, I'm asking my children on how to go about some of this technology. Before, I don't know how to use Canva. But because of my students, because of my children, I was introduced to do it. Because sometimes you need to have good presentations inside classroom, but you know, in presentations in classrooms and in conferences, that will be different. Okay, so through that, maybe we can learn also from them the way they learn from us. I would say in terms of technology. Another one, excuse me, I'd like to ask, the change of era to Society 5.0, does it make the pharmacist required to follow relevant? It must be like what you follow because perhaps pharmacist is not only focused on drug management and health consultation. Yes, actually, pharmacist is a multifaceted profession, as you know. We are not only focused on drug. We are already, before our profession is drug-centered, now we are already patient-centered. We do patient-centered care now. That's why I still stand that pharmacists cannot be replaced by robots. Because remember, as I mentioned, maybe in manufacturing, there could be with the use of these machines, with technology. But in terms of really facing the patient, it really needs, okay, a pharmacist to do the counseling because we are now in patient-centered care. That's why in our, if I will be allowed, in our education now, we are no longer really into BS pharmacy only. We have specializations already. And part of this is the clinical pharmacy. Part of this is the doctor of pharmacy. And clinical pharmacy, doctor of pharmacy is gearing towards clinical practice, gearing towards patient care, gearing towards understanding what will be the effect of the medication to the patient, what are the adverse reactions, how are we going to prevent this? This cannot be done by robots alone. Okay, this cannot be done by technology alone. That's why there is progression of our profession from merely BS pharmacy or bachelor's degree to clinical, to industrial, to public health. Okay, so it's already transforming into specialization. And if you try to look at this one, this is gearing towards our service to our patient. Okay, and I think this is the last question. What is the concrete application of pharmacogenomic concept in administering drug to each patient? Okay, so I think this is more specific. It's already pharmacogenomics concept. Now, if you try to look at the concepts of pharmacy, of the action of drug or pharmacologic action of drug, not all medicines which are expensive are effective. Okay, so we practice most of the time pharmacoeconomics and pharmacogenomics. Now, in pharmacogenomics, we look into or understanding the pharmacokinetics of the medication. We look into how the drug is absorbed, how the drug is being distributed, how the drug is being metabolized, how the drug is being excreted. And most of them, if you try to look at the effect of this pharmacokinetic in pharmacogenomic, the treatment of a certain illness has something to do with also it has something to do also of the genetic composition of the individual. Because in the pharmacogenomics, sometimes we consider this as pharmacogenetics. So this would be studying of the people's genes. So there would be differences in terms of an individual's ability to absorb, distribute, metabolize, and excrete other medication. That is the reason why we cannot share our medication with other people. We cannot tell them that our medicine maybe could be given to them in the treatment of their illness because we have difference in terms of genetics. That's why some also medications are based on the type of genetic composition of an individual. If they are fast acetylators, slow acetylators, if they are Caucasians, they are Africans, okay, so they are Asians. So it has something to do with that. So the pharmacogenomic in the concept of administering medication is very important in each patient. That's why in pharmacy, we call it as individualized treatment. We cannot give a medication for everyone that, let's say, I have a headache, you can have this, because we have to do, as I mentioned, to assess the patient. What causes that? There could be a deeper illness or disease of that patient that we need to address. And we need to monitor. That's why I mentioned earlier, we cannot have the robot, because in the monitoring and evaluation of the effect of the drug to the patient is very important. We have to call them and ask if there is a development of their illness when they take the medication, or there is an adverse effect. Because remember, in the effect of drug, in pharmacodynamics, the effect of drug, we don't only focus on the therapeutic effect of the drug, but also its toxicity. I hope I was able to answer the questions. Thank you.
And with that, we have come to the end of our question and answer session. Thank you to all the participants who have sent questions. And most of all, of course, thank you, Professor Maria, for giving a very detailed answer to all of the questions. Ladies and gentlemen, please allow me to conclude the presentation. Society 5.0 is a highly intelligent society where there is mass customization and cooperation between man and machine, where we're using the heart of the machine and hands of humans. Making use of artificial intelligence in digital therapy and personalized treatment, examples like remote diagnosis, robotic dispensing, and telepharmacy. Now, how do we as healthcare workers keep up with the 5.0? As Professor Maria has stated, that what makes us special and irreplaceable is that our service is with the heart. But there's also a strong relationship between education, society, and industry. And so we need to always be updated with the newest innovations and skills to be able to optimally utilize artificial intelligence in a super smart and creative society to maximize our service as healthcare workers. And please allow me to translate for our Indonesian viewers. Society era 5.0 merupakan era masyarakat sangat cerdas di mana terdapat kustomisasi massal dan kerjasama kolaborasi antara manusia dan mesin, di mana teknologi menjadi jantung dan menggunakan tangan manusia, memanfaatkan artificial intelligence seperti untuk terapi digital dan perawatan yang dipersonalisasi, diagnosis jarak jauh, dispensing menggunakan robot, dan juga telefarmasi. Bagaimana kami sebagai pekerja kesehatan dapat mengikuti era 5.0 ini? Sebenarnya yang membuat kami istimewa dan tidak bisa digantikan adalah servis kami itu menggunakan dengan hati. Tetapi ada hubungan yang kuat antara pendidikan, masyarakat, dan industri, sehingga kami perlu terus-menerus memperbarui pengetahuan dengan inovasi dan keterampilan yang terbaru saat ini untuk dapat memanfaatkan secara optimal artificial intelligence yang terdapat, sehingga bisa memaksimalkan layanan kesehatan sebagai petugas kesehatan. I would like to thank our speaker, Professor Maria Danabel. We are incredibly appreciative of your attendance today. Your insights were both illuminating and encouraging, and we are extremely grateful for you taking the time and effort to graciously share your expertise with us. And thus we are proud to present to you an award certificate, which will be presented by our Dean of the Faculty of Health, Mrs. Henny S. Cup, Nurse M.Cup. To Mrs. Henny S. Cup, Nurse M.Cup, the virtual stage is yours.
Okay, thank you. Thank you, Ma'am, Prof. Maria Donabel, DN PhD, for taking the time to share your expertise with us. I'm proud to present you our award certificate as our keynote speaker today. We hope our alliance will continue. Once again, we thank you for your collaboration, Ma'am.
Thank you so much. Thank you. Thank you so much for the invitation.
Ladies and gentlemen, we have now arrived at the fourth session of our international seminar, Readiness of Healthcare Professionals in Facing Opportunities and Challenges in the Society 5.0 Era. Our fourth keynote speaker today is a special guest from Al-Mamlaka Al-Arabiya Al-Saudiya, which is Saudi Arabia, a distinguished professor at the King Abdulaziz University. We are very delighted to have him here today, Dr. Ahmed Turki. But first, please allow me to read a short summary of his biography. Dr. Ahmed Turki is an assistant professor of electrical and computer engineering at King Abdulaziz University. Saudi Scientific Society for Biomedical Engineering board member, specialized in signals processing and control systems, medical wearable devices, telemedicine, home healthcare systems, and e-health. As you can see, this is a very long list of work experience. In the span of only 19 years, he has accumulated over 15 work experiences and is currently the assistant professor at King Abdulaziz University in Jeddah, He is also the board member of the Saudi Scientific Society for Biomedical Engineering in Jeddah, and is also the vice chairman of Electrical and Computer Engineering Department in King Abdulaziz University. And he is the head of Product Development Unit in the Center of Excellence in Intelligence Engineering Systems in Jeddah. Educations and qualifications. A PhD in Biomedical Engineering at the University of Texas at Arlington, the Master of Science in Electrical Engineering at the University of Texas at San Antonio, a Bachelor of Science in Electrical Engineering at the University of Texas at San Antonio, a Diploma in Academic Professional Development for University Instructors, a Diploma in Academic Leadership Skills in King Abdulaziz University, a Certificate in Compliance and Academic Advising Training for Teaching Faculty, University of Texas at Arlington, and Certificate in Academic Leadership at Saudi Arabian Cultural Mission, McLean, Virginia. Achievements: the 2021 NSF Doctoral Consortium Award, the University of Texas Arlington, the UTA Teaching and Research Assistantship at the University of Texas at Arlington, the Franklin Alexander Biomedical Scholarship at the University of Texas Arlington, the U.S. National Institute of Aging Research Fund at the UT Southwestern Medical Center, the $100,000 Student Technology Venture Competition. Third place, the University of Texas, the UTSA Senior Design Demo Day, the University of Texas, and the National Society of Collegiate Scholars, the University of Texas. Some of his publications are develop a novel PID controller for an improved economizer in the air handling unit to cut the energy consumption for an office building in Saudi Arabia by a genetic algorithm approach, Journal of the Taiwan Institute of Chemical Engineers. The right congenital diaphragmatic hernia associated with hepatic pulmonary effusion, Journal of Pediatric Surgery Case Reports. Estimation of heart variability measures using Apple Watch and evaluating their accuracy. Estimation of heart rate variability measures using Apple Watch Juli. A wearable fitness tracking ecosystem for exercise therapy for traumatic brain injury patients. An investigation of heart rate sensing accuracy by wrist-worn fitness tracking devices. And an investigation of accuracy of instantaneous heart rate measurement by wrist-worn fitness tracking devices. And without further ado, please give a warm welcome to Dr. Ahmed Turki.
Assalamualaikum warahmatullahi wabarakatuh. Welcome everyone, and thank you very much for this kind invitation. It's really a pleasure for me to be with you all here. So I'll start by sharing my screen. Right, again, thank you very much, Zahra, for this great introduction. I really appreciate it. And yes, I'll start here by introducing the title. I would like to discuss here with you all. It's about how really the healthcare is, we are living in a revolution for the healthcare. Where we have this great technology that can be introduced by medical wearable, and of course adding to that machine learning and artificial intelligence. So yes, this is me, Ahmed Turki. I'm Vice Chairman at the Electric and Computer Engineering at King Abdulaziz University, as well as Head of Product Development Unit at the Center of Excellence in Intelligent Engineering System at King Abdulaziz University. All right. So when it comes to the top 10 healthcare trends that we are living in nowadays. We can see from the statistic, it's all about how artificial intelligence in healthcare, how about telemedicine or mobile health, Internet of Things, big data and analytics, and the cloud computing. All of that, we can see this is about almost 70% of healthcare trends and innovation that, for example, was in the last year. So as my colleagues and the previous speakers mentioned, that we are living, actually, first of all, we are all blessed that we are living in this era, that alhamdulillah, God led the human to be smart enough to reach this level. And of course, there will be more improvement in the coming years and decades, of course. But again, to reach to what we have nowadays, it's amazing, of course. And as I said, the previous speakers mentioned all about how this era is taking us by, for example, by the artificial intelligence, the Internet of Things, robotics, and the ability to have this huge data, that we can collect all this data and then we can analyze them. It really open great doors and capabilities for all humanities. So of course that led us to empower healthcare professionals, enhance patient care, improve overall healthcare outcomes. And also, yes, I'm using this picture as Dr. Maria in her great previous talk, that nowadays with this society 5.0 and healthcare, we can address all of that. Of course, it's all started from the challenges that in our ancestors or in the past, where they have these problems, where people used to have, for example, less quality of life. There were diseases that we don't know what really the reasons behind them, and also, like in the past, they just used to give prescription or treatment for everyone. But nowadays, with all this capability we have, we start to hear about personalized medicine. We start to hear about the treatment compliance, all of that can be applicable with this new technologies we have. So yes, of course, the society of 5.0 era, we start to see this problem being solved by providing comfortable living, and also when it comes to health promotion, which that really means about the increasing the compliance, increasing the alerting systems about a person or individual health, and of course that will optimize the treatment, and will of course reduce a huge amount of cost and burden on governments or insurance companies when ensure the compliance and increasing the quality of life for individual in the societies. And of course, it will reduce the burden on patients and of course on the society. Okay, how really we can do all of that with of course with the capability we have nowadays when it comes to communication and also enhanced infrastructure of technology. We were able to start to have huge medical data, also environment data, and also data about the medical sites, and as well as real-time data. So with all of that, we started to have all these issues being addressed, and we start to solve them. So so yes, in my talk today, really, I'll emphasize on an application of the technology with the health care, where we have nowadays in the society or the era of 5.0, which is, for example, the medical wearables. Medical wearables nowadays, we can have or collect different physiological data, and all these data can be monitored 24/7 by these sensors. And of course, this capability in the past, health professionals, they did not have that access. They were only be able to see or get absorb information about their patient only when they are in the clinic, or when they meet the patient. But nowadays, with these interesting communication technologies and better understanding of our human body, we were able to have these wearables where can collect different physiological signals, and these wearables could be able to transfer them to a cloud system, and then the professional caregiver will be able to monitor his or her patient almost 24/7, which of course will lead to better treatment and better personalized health or personalized care giving to each individual. So when it comes to medical wearables, if we want to define them, what really they are of course electronic devices. They can be worn in different part of the body. They can be incorporated into clothing or accessories, or even sometimes actually being planted inside our body, or even taken inside our body. So of course, what they are designed for, they are designed to collect, monitor, and transmit real-time health data. And probably in this presentation, you will hear real-time health data many times, because really this is the one of the I would say the main key in this, or the amazing thing in all of these technology. It's about collecting a real-time health data. Of course, they will be composed of sensors, processors, and of course, wireless connectivity or wireless connections. They will be able to continuously monitor individual health status, and of course, that will promote the preventive care and enhance the patient engagement. And of course, probably you all know, some of these medical wearables that we are all familiar with, the smart watches, these fitness trackers, and also there are biosensors and monitoring devices now wide available. So yes, what are the important functions that I want to emphasize today when it comes to medical wearables? It's all about health data monitoring, and as I just mentioned, we have different parts of the bodies that we can utilize to collect different health information, and of course in the past years in hospital they were able to collect this data, but again nowadays we have the capability to build cheaper sensors, better when it comes to do all these, for example, prediction of the signals from different part of the body. For example, we can integrate into clothing different sensors to collect ECG data or EMG, respiratory rate. And again, we can have these all of these sensors integrated to a communication point where this point can transmit the data to a cloud, and then the healthcare professional can have access to that data. So yeah, of course, when we have all of that, we will have a better disease management, especially for those with chronic problems. Usually, one of the biggest burden that or the highest cost usually on health facilities or governments when it comes with dealing with chronic patients, because this type of patient that they will require continuous monitoring, continuous hospital visits. So with enabling such technology, of course, we will reduce that burden and reduce amount of cost and on hospitals and on insurance companies, on governments, where we can have that management done remotely, of course. So, for example, nowadays where we have these wearable glucose monitors, as the one, for example, in here in the picture, where they have this glucose monitor patch that can communicate with the phone and the data, for example, being sent to the health professionals. That will give the access where the doctor of a certain patient can decide to change or improve the medication or the diet or the lifestyle to that patient. Other things, as I mentioned, for example, the fitness trackers that we have, for example, all these smartwatches, Apple Watch, Samsung Watch, and etc. They have the capabilities and these cheap sensor integrated into them, where it can know some basic physiological signal, and based on that we can know the fitness and wellness of that user. For example, a number of calories burned and sleep quality, for example, also step takens. And the other interesting thing is that, for example, by doing some certain of a calculation, let's say with these fitness and wellness trackers, for example, it can give us a photoplethysmography signal that can tell us the heart rate value. By doing some certain calculation on this signal or value, we can start, for example, know idea about the heart rate variability. Heart rate variability, as the probably you can know from the literature, heart rate variability can be utilized to different application. To, for example, to know the fitness, and the change of the heart rate variability can give you some indication about a user fitness, or even sometimes heart rate variability can be utilized to know information about the brain health. So really, we can see this is the beauty of all this technology, where we can get certain information from part of the body, and by doing certain calculation on that signal or on that data, we can start to know another information about other part of the body. For example, yeah, like this fitness monitor, we have students working on building a build similar to the one here in the picture, where they want to use it for monitoring a football player fitness by using the calculation of heart rate variability. So yes, and again, here about remote patient monitoring, as been now mentioning in the presentation. Yes, the technology give us that access nowadays. Who can benefit of that? As I mentioned, the people, for example, with chronic disease, elderly people, people live in remote areas. Of course, that can give us give us the detection of early sign of any changes that can be a concern of the health caregiver. And again, yes, prevent hospital readmissions and enable the timely intervention. So really, with such technology, we can have the patient who really needs immediate care or immediate attention will go and be admitted to the hospital. For example, here, this is a system that we utilized here for traumatic and patient injury, for example, where probably TBI patients, traumatic brain injury patients, they found out part of their treatment is physical exercises. It's really not just physical exercises, not something to mediate their condition. It's really the prescription. It's really the treatment for them, physical exercises. And when it comes to the physical exercises, also they have to start practice these exercises within immediate period of time after the injury. So the timing for starting doing these exercises, and also the compliance, it's really was something critical for to treat these type of patients and give them the help they need. So really, we by employing or recruiting such technology when it comes to smartwatch or the smartphones, we were able to design a system that give the needed prescription for each patient. And also in the other side, the neurologist and also the physiotherapist, they were in that team. They were wondering they know, okay, the physical exercise is the treatment their patient needs. But really, there were that question that how much we should give to each patient. Of course, we can tell based on the severe of the injury, but again, not every, for example, severe patient or severe TBI patient is the same as the other. There, of course, each one has different severity of the injury. So recruiting or employing such system was able to decide how much each patient needs. And that's here comes into the personalized medicine. So of course, at the beginning, the doctor gave certain exercises for a certain time, but then within time, and of course, with checking up with the patient progress, the doctor started to know how much how much exercise each patient needs for their health condition. So yeah, such system was able to give the instruction for the user how to do the exercise, how many times a day they need to do the exercise, really give them all the prescriptions on their personal account on their phones, and then all these prescriptions will be reflected after that on the smartwatches. Another thing or other aspect I want also to emphasize here is that something extra this technology can give us is, for example, inserting the gamification part, where that really can help increasing the compliance, for example, for the patient to do their exercises, to give them that extra motivation to do their exercises and be on track on their treatment. So whenever the patients start to get tired, or like the patient start to give up, or for any reasons, these systems can start to motivate them by either the gamification, or even sometimes it gives these pop-up messages to keep going, or to share them to continue with their treatment. Also, other thing, the feedback. For example, in that scenario here, the patient were able to answer after finishing the exercise how was, for example, the exercise rate of exertion, and from that the healthcare profession start to know if these exercises is good for their patient or not. So yeah, we have here it was an example like how we can recruit available sensors with for example available technology. So yeah, and of course other thing when it comes to remote patient monitoring, for example, if the doctor feel that there is not enough progress, will be able to communicate with the patient and tell them to either to contact them back, or and yes, this technology can give that quick access to the doctor, where the patient can call the doctor or a representative for the doctor to tell them about their concern. So as you can see from this example, really, it will be a 24/7 care for the patient. So so giving these accessibilities, that really will empower the patient. It will increase the patient engagement, where of course all of that comes from this personalized healthcare. Recommendations will be given, reminders, and also access to educational resources. If really we think about it, in the past we could not have access to such technology. And one of the most important things, yes, the ownership and responsibility for each one health, how they can feel, how they are responsible about their health, and also understand the treatment that they are being given. It's not just about following, they go to a classic clinic and then the doctor just tells them certain instruction and they just go home and try to do that, and without really understanding what's going on with their own health. So yeah, one of the great accessibility this technology is the patient environment, and make the patient know more about his or her own health. And of course, that when it comes to us as a researcher, that gave us the power of collecting all this data, where we can have better understanding of the population health, and know about how is the health trends, and start to understand the relationship between different physiological signal, different factors in the society on the society health. So when it comes to medical wearables, what's really the most important thing, how we can really make a medical wearable? It's all about understanding the best biomarker, understanding, okay, which information we will collect from the human body and how we will utilize that. And of course, there are different and many challenges, of course. Yeah, we've been saying we are thankful that to the level of technology that we reach nowadays, but of course there are so many challenges to be able to do that. First of all, I would say each person is different. Each person has his own, as also the great speaker Maria in a previous talk said that each one has his own genetic, for example, code, and that sometimes make it challenging when it comes to we want to create a system that can work for all. And especially if we want to have that personalized medicine, we want to have that personalized healthcare. Yeah, how you can make your system be adapted to everybody for different ages, different health situation, and be able to distinguish all of that. So really designing the best sensor by finding the best biomarker, and of course you have to keep in mind building such system. It takes everybody. It takes all the disciplinary, multidisciplinary. When they say multidisciplinary, such applications multidisciplinary, it's really they are different researcher from different backgrounds. They all work together to enlighten each other, to understand the way our works, the way intelligent system work, all these electronic systems. So yes, going back to the point that I want to emphasize here, it's all about finding the right biomarker, and of course we can reach that by the collaboration from all these teams, where we can understand and be able to create a sensor, for example, that can collect different data. And when it comes to find, for example, a technology to find the vital sign, for example, like the heart rate or blood pressure or respiratory rate, or any of all of these, there are different sensors that we can utilize, and doing so that we can use one of them, for example, to be able to predict the others just by studying the relation for all these markers, and be able to understand what's the relation, for example, when it comes to stress level to heart rate or blood pressure. So really the key here is how we can use one or only collect one biomarker to predict the others. An example of that, for example, we are working on a study that we're trying to detect sleep apnea. Probably, if you know that sleep apnea, it's all about when the patient, the airways of the patient get congested or collapsed, and the patient start not be able to breathe while they are sleeping. There are so many patients around the world, they are having the symptoms of sleep apnea, and probably they don't know. They just, when they wake up, they feel that they did not have a good sleep. Well, they are, some of them, they really, for example, have that problem of sleep apnea. So using, for example, a heart rate monitor or certain kind of technology that, for example, tell us how was the heart during sleep, and then after that analyzing that physiological signal, we and of course with the training of the system, we can know from the abnormality in the heart rate that the patient could had the symptoms of sleep apnea. So as you can see, from one physiological signal here, we started to get some information about that or patient health, a patient health in certain application. So I'll when it comes to the design, what are the main I would say, of course, this is a block diagram. When it comes to develop a wearable system, what really the main part of a wearable system? It's all about, of course, a wearable sensor, and then a point of communication. It could be a cell phone, or sometimes this wearable sensor integrated with a point of communication, have that being sent to a server, a cloud. And also nowadays the clouding systems being developed, where we can have this virtual cloud, like if you probably all know, we have those Amazon web servicing or the Microsoft Azure. All these clouds, they can they give part of the spaces they have for the people to utilize and have their data uploaded to their servers. And then once we can have a clinician portal, that portal can contact or communicate with this cloud, where can access all these data being sent by these two guys here. So to have really to be able to do that, it's will really all start from here. What wearable sensor we will use, and it's as I said in the previous slide, it's about finding the biomarker, and then after that, how we can create a sensor, build a sensor, or use a sensor, for example, that is available in a market, and recruit that sensor to have that our wearable system. Of course, if we're going to either choose a sensor from a market or even build our own, of course, at the end, we need to test it or select it based on certain criteria. And we can do that by comparing any of those sensors to a gold standard. What we mean by gold standard is it's either a device or a system that is already being used in health facilities and being approved by certain accreditation society or agency. So yeah, for example, when we had that project, when it comes to finding a best sensor to use with our TBI patient or traumatic brain injury patient, for example, we had to choose different, and at that time, yes, we decided to go with something available in the market, so everyone worldwide can have access to this sensor. So we decided to use smartwatches, and then we went ahead and tested several smartwatches to a gold standard device, which it was at that time approved and accredited electrocardiograph, ECGs. And we compared, yes, the heart rate measurements by different smartwatches. And of course, we had that as a preliminary study on at the beginning of designing our system. And then, of course, once we collect all the data from all these sensors from different volunteers or subjects, we calculate or validate the quality of that sensor by different calculation method. For example, here using a root mean square error for each measurements of the data can start to give us how far each sensor from the gold standard one. Other way to validate or visualize that is, for example, a famous way of calculation is the Bland-Altman graph, where it gives you how far each sensor that you're trying to use from the gold standard, and telling you the difference and the mean measurements for both for the sensor you're trying to use. So okay, now let's say we find the best sensor. We start to have a data. How we can have a cloud system, how we can have our system be smart enough to tell us, for example, if this person is healthy or the person is not. How we can utilize the machine learning, for example, in this regard. So,
Doctor,
yes.
Doctor, I'm very sorry to inform that time is running out.
Okay. Yes, I'm about to conclude. So, so how many I can finish in how many minutes?
I'm so sorry. It's because the time of Dhuhr is here in Indonesia.
Okay, just if you can give me 3 more minutes,
Yes.
and I'll conclude all of that. Yes. All right. So really quick. So when it comes to have all of that data, and then we try to train or learn our system. It's all about when it comes, for example, we collected all that data. We had that data acquisition, right? Of course, that will be a bunch of data. We don't know what does it really mean. So of course, we have to give it some kind of filtering. And then after we filter it, we start to have that features here. For example, if we have this, our happy face, we start to see that features here. And then after that, we need to train our system. What part to look at? For example, we give it that 2 circle and this curve, it means the happiness or being happy. So after that, we train the system. If you just see these 2 circle and that curve, that means it's a habit. That's basically, it's in very basic way how we can train the system. Of course, we have different ways to extract the feature from all of these physiological signals. And of course, there are different prediction methods being applied. And one of the most famous one is the support vector machine in the medical application. So yes, again, since we have all of this data, we can pre-process it, train the system, give it, for example, if there are some kind of presentation, give it some numeric values, and then apply these prediction models. Other most important aspect is the security, of course, when it comes to encryption or how we can have it authenticate and access the data. And other more important thing is how we can have our system integratable, where it can works with different sensor, different devices, and of course give it to the quality of the service. We cannot have latency or missing some data in our system. All of that, it should be taking care of any of these cloud or smart system. And the last important thing is about the security of data. It has to be comply with, for example, either the HIPAA, the Health Insurance Portability Accountability Act that's from United States, or the General Data Protection Regulation from the European Union. So, and then how we make sure that our server also is secured using different, there are different architecture. Just we make sure that everything is secured in the server. These devices, for example, either from the clinician or the user, do not have access to change or do the calculation of the data. It's all being done here. So they can just be a mirror of whatever it's in there. So yeah, I'm just I try to wrap it out. I'm sorry if I take a longer time. But one last thing I want to finish my talk with. And I saw many questions in the previous talk. They were asking if is the machine will come in place of the human at the end when it comes to all these facilities or capability. Really, I would like everyone to think about it. The answer, of course, it's no, because at the end, we cannot replace, for example, an airport just because we have an airplane. We cannot replace having a hospital just because have some doctors. Again, we need to think about these tools they are a tools. They are like a device to assist us, us. And again, as much as the machine gets smart, at the end, it's not that smart. Again, we train the system to know the difference between an apple or orange. So you think a system that needs that at the beginning will be able to come instead of the human? Of course, no, but it will be a great tool that we can recruit to do all this application and make them better and enhance all of these applications. Thank you all very much. And I'm sorry if I take longer. And yes, if there are any questions, I'll be more than happy to address them. Thank you very much.
Thank you very much, Dr. Ahmed Turki, and I'm very sorry about the time. If we could extend, we definitely would, because this is a very interesting
sure, no problem.
subject, and this is something new for us here. And we have come to the discussion session. There are a few questions here. The first one is there an impact of electrical or electromagnetic transmissions from using medical wearables on cell activity and the nervous system? Does every medical wearable require calibration to get accurate results?
Well, yes, sometimes this is part of the challenge when it comes to the calibration, that how we can make the system adapt to different users. But again, with training and having a good mathematical models, we can come over that. When it comes to the EMI or the electromagnetic interface or effect on the human, well, at the end, we do have that electromagnetic signals around us. We are all with cell phones. We have all these radio signals around us. So at the end, when we are designing this system, we try to not have them affect our body or our organs. They are with the limits. They should be with the limits that should not harm our body. But again, at the end, we are all living in a huge communication systems, and they are around us already. Why not utilize them?
If one more question from Sylvina, what about the common people who don't understand the medical devices available in the 5.0 era, and how to educate those who don't understand?
Well, I believe again, yes, by advertising, of course, and us actually, for as an engineer, we target more the health professions because they are the one who really gonna give that to their patients. So really, by advertise to what technology can do nowadays to the health profession. I really believe that it will be from there, from the health profession, where they utilize them with their patients.
Thank you very much, Dr. Ahmed Turki, for the very detailed answers. Due to time limitation, we have only been able to choose 2 questions right now. Please allow me to conclude. Using artificial intelligence, we can now not only treat patients more optimally, we can also start preventing diseases in patients. For example, the incredibly innovative medical wearables, it can be worn on the body and it is able to collect, monitor, and transmit real-time health data from individuals. This will allow a better understanding of the condition of the human body and therefore promote better treatment, better management, and better preventive care. This can also facilitate remote monitoring of patients who are elderly or live in remote areas, and so it can prevent hospital readmissions and reduce overall medication costs. Not only this, but patients will also be engaged and empowered, for they will have access to their health data and are able to participate in their own healthcare. So in the 5.0 era, we should encourage the implementation of wearables to increase the service of healthcare workers. And to translate for my Indonesian viewers, dengan menggunakan artificial intelligence, kini tidak hanya dapat lebih optimal merawat atau mengobati pasien, tapi juga dapat mencegah penyakit pada pasien. Misalnya dengan menggunakan medical wearables yang sangat inovatif. Medical wearables dapat dikenakan pada tubuh dan dapat mengumpulkan, memantau, dan mengirimkan data kesehatan real-time dari pasien. Hal ini akan memungkinkan pemahaman yang lebih baik tentang kondisi tubuh pasien sehingga dapat mempromosikan pengobatan, manajemen, dan pencegahan yang lebih baik. Hal ini juga dapat memudahkan pemantauan jarak jauh terhadap pasien yang lansia atau tinggal di daerah terpencil, sehingga dapat mencegah masuk kembali ke rumah sakit, rawat inap, dan mengurangi biaya pengobatan secara keseluruhan. Tidak hanya itu, pasien juga akan dilibatkan karena mereka akan memiliki akses ke data kesehatan mereka dan selanjutnya dapat berpartisipasi dalam perawatan kesehatan mereka sendiri. Maka di era 5.0 ini kita harus mendorong implementasi wearable untuk meningkatkan pelayanan tenaga kesehatan. And I would like to thank our keynote speaker, Dr. Ahmad Turki. We are incredibly appreciative of your attendance today. نقدم لكم جزيل شكرا على حضوركم معنا في هذا اليوم. ما قدمتم لنا كان مضيئا ومشجعا. نحن شاكرون على ما بذلتم لنا من وقت وجهد في نشر معلوماتكم وخبراتكم الغالية. Thus we are proud to present to you an award certificate which will be presented by our Counselor of Student Affairs, Mr. Darmasta Maulana, SKEP MKes. To Mr. Darmasta Maulana, SKEP MKes, the virtual stage is yours.
We hope our alliance will continue. Once again, we thank you for your collaboration, and I hope we meet next year in Haramain.
I'm sorry, the sound is escaping, I believe. I cannot hear really well.
To Mr. Darmasta Maulana, SKEP MKes, your sound is not audible. Bapak punten suaranya tidak terdengar.
Oke, apakah terdengar suara saya?
Sudah, Pak.
Okay, thank you, Sheikh Dr. Ahmad Turki, for taking the time to share your expertise with us here in Indonesia. I am proud to present to you an award certificate as our keynote speaker today. We hope our alliance will continue. Once again, we thank you for your collaboration, and I hope we meet next year in Haramain. MashaAllah. Barakallahu fikum, Sheikh.
Inshallah, it will be my pleasure, yes, for you all to be here. And thank you very much for this great opportunity. I'm really glad to be with you here today. Thank you very much.
Thank you.
Thank you.
Ladies and gentlemen, we have now come to the end of the third and fourth session of today's international seminar. Thank you for giving me the honor of serving as your moderator for today. I will give back the virtual stage to the MC, Mr. Brizas.
Yes. Thank you to Ms. Zahra. Now I will announce the door prize winner. I'm going to share the screen first. Dari sana, pas di mana? Ya. Enggak. For the first winner, for the category of the earliest participant for joining the webinar, to Epita Kusuma Dewi. For the winner, there's a contact. You can contact Miss Ayu Idaningsi with the phone number in here. You can screenshot the picture first. Moving on, we have the best question for the session 1. Number 1 is Sophie Soliha. For the second is R.A. Cinta. The third is Khaironisa. For the best question for the session 2. Number 1, Silvina Julia Utami. 2, Gina Nurlaila Arba. 3, Ratih Permata. For the session 3, Silvina Julia Utami, Ivana Eko R, and Dewi Puspitasari. For the last session, Mutia Shahida, Sophie Soliha, and R.A. Sinta. To all the winner, please contact Ms. Ayu Daninsi. The phone number is 0813 9581 2181. Thanks. Ladies and gentlemen, as we draw near to the end of this remarkable international online seminar on readiness of healthcare professionals in facing opportunities and challenges in the Society 5.0 era, I stand before you as your master of ceremonies with a profound sense of gratitude and fulfillment. Over the course of our time together, we have witnessed thought-provoking presentation, engaged in lively discussions, and fostered connection that transcend geographical boundaries. We have explored the transformative power of technology, the ethical consideration in healthcare, and the collaborative efforts needed to shape the future of healthcare in the Society 5.0 era. I would like to express my deepest appreciation to our distinguished speakers, whose expertise and insights have enlightened us and ignited the spark of innovation. Your valuable contributions have left an indelible mark on this seminar, and we are immensely grateful for your willingness to share your knowledge and experience. I would also like to extend my heartfelt appreciation to the organizing committee, technical support team, and all those who have worked tirelessly behind the scenes to ensure the success of the seminar. Your efforts, dedications, and attention to details have made this event possible. As we bring this international online seminar to close, let us carry forward the knowledge gained, the connections made, and the inspiration ignited during our time together. Let us remain committed to the pursuit of excellence, embracing innovation, and collaborating across disciplines and borders for the betterment of healthcare in the Society 5.0 era and beyond. I encourage you to maintain the connection established during the seminar, to continue sharing ideas, and to explore opportunities for collaboration and growth. Together, we can make a lasting impact on healthcare delivery, driving positive change and improving the lives of individuals and communities. With that, I officially bring this seminar to a close. May the connection and insights gained here continue to inspire and guide us in our future endeavors. Let's give applause to all of us. Thank you and farewell.